me just a minute. I'm waiting for my streamer to come on board, and then we'll be ready to get started.
Chris was on the other meeting. I told him to jump over here.
Thank you. I just noticed that he wasn't with us yet. Yep.
You're unmuted. So your video is on.
So where's my picture?
Participants.
Oh, okay.
Okay. You want to see the pictures?
Yeah. Can't leave it. Wait. Sorry.
James, it looks like all the counselors are here.
We're waiting to get the live stream up. We had to take down the previous one and pull up the next one. So we're just getting YouTube all set up, and then we'll be live to go.
Perfect. Thank you.
You're welcome. Okay, Mayor, we are live, so I'm going to mute everybody. We'll get started with the presentation.
Good evening, everyone, and welcome to the Newington Town Council regular meeting of June 9th. We are starting a little bit late this evening at 7:21. My apologies. I'd like to call the meeting to order. We did have an executive meeting prior to this, so we did run a little over. So I apologize to those members of the public that were waiting for us. The first item on our agenda this evening is the Pledge of Allegiance. If you would, please rise for the pledge and join us if you're able. I pledge
allegiance to the
flag of the United States of America
and to the republic
which stands
one
one nation
under God,
indivisible, with liberty and justice for all.
Thank you, everyone. Susan, if you would please start us with roll call.
Oh, sorry. Counselor Anik,
Here.
Counselor Braverman,
Here.
Counselor Draco,
Here.
Counselor Camillo,
Here.
Counselor Donahue,
Here.
Counselor Mink,
Here.
Counselor Minor,
Here.
Counselor Nagel,
Here.
Mayor Del Buono.
Here.
Excellent.
All right, thank you. Everyone's present and accounted for. We will move on to the next item, which is approval of the agenda. I'll entertain a motion to approve the agenda.
Second.
Thank you. Motion made by Counselor Mankey, seconded by Counselor Annis. Any discussion on the agenda? Guys, I'll remind you, we're going to have to use the raise hand function. I know it's cumbersome, but it will help us stay in order. I don't see any discussion. So all those in favor for this one, I think we don't need a roll call. We can just, all those in favor say aye.
Aye. Aye.
Any opposed? Motion passes. Thank you. Moving on to the next item on our agenda, which is public participation. Anyone from the public who would like to speak can do so by using the raise hand function. I'm sorry, I'm juggling my technology here. The raise hand function in the participants window. In addition, if you're calling in on Zoom, you can use *9 to exercise the raise hand function. So I do see one member of the public who would like to speak to us. Let me just unmute you.
What?
All right. Hi, it looks like Charles Sullivan is the caller ID. If you could just identify yourself for the record and state your name and address, and you're with the town council.
Yeah. Hello, my name is Charles Sullivan and I live on 88 Fisk Drive.
There's a.
Welcome.
Whatever.
There,
So,
Would you like to speak with the council? Go ahead.
oh, yes. I attended our Black Lives Matter protest in Newington on the 4th. One side of my sign read, "What are you afraid of? Accountability?" This is important because as I was heading back to my car after the crowd had dispersed, I heard a voice from behind me call, "I'm not afraid of accountability." I turned around and saw an older white cop snickering about it. I stopped in my tracks, and whether it was because I was dumbfounded or petrified, I couldn't find it in me to speak. And I left even quicker. In doing research for this meeting, I found an article published by the Middletown Press in which they tested how every police department in Connecticut gives records and information. Newington got a B- sunshine grade in Freedom of Information Act compliance. It's not a good sign when panicked students trying to make honors rolls and dean's lists hold themselves to higher standards than your police department. How does our town benefit from failing to readily provide information? FOIA ratings came up in my search because I was looking into a case, specifically the state of Connecticut versus Christopher Jenkins, an incident that essentially centers on police misconduct. Despite this concerning central theme, all but its initial report have been wiped from the NPD's records, despite the last of the court cases being complete in November 2010. If you have the privilege to not have known about this case, Newington detective Michael Morgan pulled over a Black man, Christopher Jenkins, for a traffic violation. He believed that the man was unusually nervous for a traffic stop. He checked the man's license, registration, and the rental agreement for his car. All of this came back clear. After writing the man's ticket and explaining it to him, thereby completing the purpose of the traffic stop, he did not hand over the ticket. He instead asked Mr. Jenkins if he had anything illegal on him. He said he didn't, and Officer Morgan patted him down. There was nothing. He then asked if he had anything illegal in his car, and Mr. Jenkins said that all he had was beer on the passenger side floor of the car. When the officer asked to search his car, Mr. Jenkins gave him what he believed was only the right to check the beer case. Without informing Mr. Jenkins he had the right to refuse the search, the officer searched his car and found drugs. This case went from the trial court all the way to the Supreme Court of the state. As an undergrad law student, I could sit here all day and argue with you about whether the Connecticut State Appellate Court was right to argue the detective search was unlawful and approved the motion to suppress the evidence found as the fruit of the poisonous tree, or that the CT Supreme Court was right to reverse that ruling and send a man to jail for up to 20 years. But I think it's important to know what the appellate court explained in its majority opinion. Besides being the only of the two courts to refer to the Connecticut statute that bars an officer from extending a traffic stop outside the scope of its initial cause, where the Supreme Court chose to focus on the federal regulation which held the officer to a lower standard. What the appellate court discusses is that the officer's search was unlawful because after patting down Mr. Jenkins for no directly justifiable reason, he failed to, as a court case states, purge the taint of Mr. Jenkins' illegal detention before asking to search his car. He did not do enough to make Christopher Jenkins, a Black man outnumbered 2-1 by white cops, feel like he was in a position to exercise his rights. And while that is the legal standard from the Terry v. Ohio SCOTUS case, I feel it works in our social situation as well. Black people in our community are finally stepping up to tell us that they cannot feel safe or respected here because they have experienced racism and profiling at the hands of our police. If Newington is to truly be a town I and many others can actually feel proud to live in, we have to remove that taint. And our current police force is failing to take actions to do that. For them to take a knee with us is an empty gesture, and Chief Stephen Clark's words rang entirely hollow as he failed to tell us how the NPD would keep the outrageous actions of cops across the country from happening here. If that cop who called out after me at the protest and all of his fellow officers are not afraid of accountability, it is because they have never truly experienced it. And how do I know this so certainly? Because Michael Morgan, the cop who racially profiled the Black man in 2004, he's now a lieutenant. I yield the rest of my time.
Thank you. Okay, I'm looking to see if there's any other public participation. Anyone else who'd like to speak, again, can use the raise hand function. I'll give it just a second to see if anyone else would like to speak. Okay, so seeing none. we're
You
going
have one. She just raised her hand.
Oh, I'm sorry.
Hello, can you hear me okay?
Yes, go ahead. Please state your name and address for the record.
Oh yeah, my name is Anna Saunders. I live on 30 Camp Avenue. Can you see me?
No.
We cannot see you.
Okay.
I can see your screen. I can see your name. That's all I can see.
Oh, all right. I don't know how to change that, so I'm just gonna go with what I have here. In light of recent events in Newington and across the country, I'd like to also discuss the conduct of police officers in our town. I knew that people's accounts of their experiences are complicated, often unrecorded, and have a degree of subjectivity. So naturally, I turned to what the statistics had to say. I would now like to present to you the first homework I've done by choice in years. In my search, I came across a report published last month by the Connecticut Racial Profiling Prohibition Project, which analyzes traffic stop reports statewide for the year 2018. It found that of the 94 precincts in Connecticut, and of the 62 that were found to have racial and ethnic disparities between their traffic stops and their population demographics, Newington was one of the 8 that exceeded the threshold on over half of the listed criteria for racial profiling. So I made a chart to represent the minority population of driving age. It showed 14.5%, which is, yes, minority population 14.5% and white population driving age again, 85.5%. An analysis of the traffic stops for our town in the same year should be relatively similar, assuming that they're being conducted fairly and without bias, but this is not the case. 14.5% minority population, yet 44.8% of all traffic stops were minorities. There is a visually apparent, statistically significant difference there. It is a 10.7% increase from the already shaky state average, and there is a 30.3% discrepancy that our population demographics should not allow by chance alone. There is the counter argument that this idiosyncrasy is the result of minority drivers passing through Newington. The statisticians at CCSU thought of that as well. They also analyzed the stops of minority residents only and found that the difference in our town was 9.1%. I don't know how to track the number of minority drivers that pass through our town, but those numbers certainly make me uncomfortable, and I imagine it makes our minority residents uncomfortable as well. Chief Stephen Clark stated that the NPD has been working with the Center for Policing Equity and has been doing so since 2017. I was curious about how the statistics from both years compared, and every statistic I have mentioned so far has worsened from 2017 to 2018. If the NPD's core values include respect, defined on their website as recognizing the authority they hold, treating others as they would like to be treated, upholding the law, and honoring their responsibilities to the community faithfully and without bias, why is there statistical evidence suggesting that they racially profile the people they promised to serve and protect? I am not here out of hatred, and I am not here to attack. I just believe that we are owed answers. If there is a statistically sound explanation for all this, some confounding variable I missed, or at least a concrete plan to improve, I welcome it. I am not here because I want to be. This is hard, but I know that if it's hard for me to speak up, it is so much harder for people of color in our town to do the same. I'm here out of love for my community and out of faith that we can do better, because our community deserves better. I yield my time.
Thank you, Ms. Saunders. Okay, I'm just looking to see if there's anyone else with a raised hand. Seeing none, we will move on to the next item on our agenda, which is email correspondence under public participation. Does anyone have any email correspondence to share this evening? Okay, seeing none, we will move on to the next item, which is remarks by counselors on public participation. Again, counselors, please use the raise your hand function if you'd like to be recognized. All right, seeing none, we will move on to consideration of old business. The first item is health update COVID-19, and we have Mr. Charles Brown with us from the Central Connecticut Health District. Welcome, Charles.
Thank you, Madam Mayor.
The floor is yours.
Well, there's good news to report at this point. We have actually started to see, as many of you know, the number of cases going down across the state, which is a good sign. But it's also a sign that the things that we have been doing, the extraordinary measures that we had to take in March and April and early May, actually worked to do what we wanted it to do, which was to actually lower the curve below the threshold to which the healthcare system could handle it. That being said, Newington has had 387 total cases of COVID-19 as of this afternoon, with 51 deaths also. That balances out to about a 13% case fatality rate. So for every person that gets it, there's 13% of those people actually pass away. Newington has about a little over 30,000 people. Of those 30,000, as of this afternoon, 1,613 people have been tested for COVID at this point. And as I mentioned, that 387 of those were positive. So we're only looking at, with that 387 positive, about 1.3% of the population of Newington have actually contracted this disease. Now, from a public health standpoint, that's a pretty important number because that means we're a long way away from herd immunity. And there's a lot of opportunity for this virus to continue to spread. So I'm here tonight to basically give some messages, some basic messages about being cautious as we approach the reopening. Florida, Texas, and California are about 1 to 2 weeks ahead of us in schedule with their phased reopenings. And what we've seen from them as far as over the last couple of days is their rates have started to increase once again. They were in a decline, and they've actually opened up their businesses, and beaches and public areas, and they've started to see that decline stop, level out, and begin to rise. So, I caution us as we go into reopening, to make sure that we're doing the things that we're supposed to be doing, that we continue with the social distancing, that we continue to assure that we're washing our hands often, that we're making sure that we stay those appropriate social distances away from people, wearing the mask where it's appropriate, and protecting those people who are of high risk for contracting COVID-19. Newington, as I mentioned, they have the second highest case fatality rate within our district. And our district, just to remind folks, has Rocky Hill, Berlin, Wethersfield, and Newington. Rocky Hill has a case fatality rate of 20.7%, which is extremely high. The state average is about 9%. So Newington and Rocky Hill are both above that average. And the reason for that is there's a high number of nursing home and skilled nursing facilities in each of those towns. So we've seen those populations have been inordinately affected by this particular virus. And that's one of the reasons why we closed them down and tried to isolate them very early. Unfortunately, like I said, this virus is very opportunistic. So trying to get to that population, and it has made quite an impact. So as we know that the virus is within our community, let's make sure that we're doing the appropriate things to safeguard ourselves and our families as we move forward. And I stand ready for any questions.
Thank you. All right, Council, I'm going to open it up to everybody. Councilor Minor.
Thank you. Thank you, Charles, for spending the time to be with us tonight. With the numbers that we're seeing predominantly in terms of the loss of life coming from both long-term care facilities and group homes, what number of residents in the core balance of the remainder are you seeing affected?
It's a relatively small number, and that goes back to the reasons to how testing has actually been conducted up until this point. Up until this point, until very recently, you could only get a test for COVID-19 if you had a physician's note to be able to do so and met criteria that you actually were symptomatic that was consistent with COVID-19. They've only recently started to relax those measures. So that's why you see only about 1,600 people within Newington that have actually been tested at this point. So right now they've actually have relaxed it to the point to where you can go and actually get a test if you choose to. And I know that the State Department of Public Health is actually starting to do some testing across the state for antibodies to try to determine what the prevalence of disease is within the communities as a whole within the state. That's an important thing to do. We're still waiting for the results from that. But, you know, we can definitely say for sure, just based upon the testing that we've seen within the nursing homes and group homes, that the virus is actually circulating within the community.
Okay, and just one more follow-up to that is, I know that WHO has come out with some recent data, or there's possibly some data that suggests that the asymptomatic spread is not as concerning as it originally was. And just looking to see if you've seen anything factually to back that or support it, or if you're hearing or seeing something otherwise. My concern is that as we lag into almost 3 months now, and we as a town are looking to try to establish a safe degree of normalcy, that the disease is not more harmful, or the cure is not more harmful than the disease. And just wondered if you could speak to that.
Yeah, and I can speak to that. So the WHO did come out with a report that said the asymptomatic transmission was very rare yesterday, and they actually got picked up by a lot of news services over that. They've since backed off and said that that statement was misunderstood. That was going around today. And the studies that we've actually seen from China, from Europe especially, has shown that the majority of people who actually are infectious are pre-symptomatic or asymptomatic. So about 40 to 50% of people that are spreading the disease actually show no symptoms at the time that they're spreading the disease. And that's one of the major factors that makes this particular virus a big public health threat. Because even though you're not feeling ill at the time, you absolutely may be infectious. You may be pre-symptomatic at that point. And we have seen quite a few, and we follow up with a lot of the cases that show that there's very mild symptoms sometimes with respect to people's, contracting this virus. And the problem there is that as we start to roll back our restrictions, people are going to do the things that they normally do. It seems normal. It's a bright sunny day outside. Let's get together and have a picnic and do all those things that we want to do and enjoy doing within our communities. The challenge is this virus still exists. There hasn't been a magical switch that's been turned off, and it's still just looking for the opportunity to find somebody who has not had the antibodies for it, so that it can continue to propagate. So one reason that I mentioned that number of people tested versus the population is to show that there's still a lot of people within Newington that have the potential to contract this virus. And the only thing that we've really done, and it's been an amazing thing, is that the restrictions that we put in place brought it down to the point to where we can start to remove those restrictions, that we can start to think about that. As a public health professional, every time that I consider these things, I have to look at the balance of the situation, because each restriction that we remove, each interaction that we allow, gives this virus an opportunity to continue to spread. And I've seen the deaths from this, and I've spoken to the people who've actually lost their friends and their relatives as we've done contact tracing. So I know that there is a cost for that particular freedom. And, as we start to continue to remove these restrictions, we have to be reminded of that cost.
Thank you. Chris, are you all set?
Yeah, no, I don't want to go ahead and control the meeting. By all means, go ahead and take any other questions.
Thank you. Counselor Annis, you're next.
Thank you. Thank you, Mr. Brown, for that presentation. You were talking about the long-term care facilities as well as the assisted living. Can you give us the numbers of the deaths that were in our 3, 4, 5 facilities that we have in our town?
I don't have the numbers at my fingertips, unfortunately, but I can say that it's a large percentage, almost maybe 85% of the deaths that we've seen have occurred within those facilities. So it has been few outside, and the majority of people that do succumb to this disease are those people that are over 60 years old. So as you get in and go up every 10 years to 70 to 80, the fatality rate does increase, unfortunately.
Is that percentage the same percentage that have tested positive in those facilities?
No, it's not the same percentage that's tested positive. So not everybody that actually contracts the disease within those facilities do pass away. So they have seen some people recover, but they do have a high percentage of people that within those facilities that have contracted.
Do you know if our facilities have areas just designated for the COVID patients?
Yeah, and that's one of the strategies that they use to be able to actually fight this disease within the facilities themselves is by cohorting the patients. And we've actually had the Department of Public Health doing what they call point prevalence surveys, where they go in and they test everybody within a facility all in one day so that they can determine what the health status is at that point in time. And then they were able to take those COVID positive people, put them together in one ward, take the ones that are negative or presumed negative, put them in another, and those people who are exposed and are waiting to see if they actually contracted, to quarantine them in the appropriate place. So that is absolutely sometimes the only tool that we have in our toolbox to be able to address this type of spread within the facilities.
Thank you.
All right, thank you. Counselor Nagel? Counselor Nagel, are you there? Oh, you have your mute on, Dave.
There we go. I got it. Thank you for being here tonight. Many of the questions I was going to ask have already been asked, so I won't be repetitious. But many people in town want to know when will things open? When is it safe for me to be somewhere, specifically the parks, specifically meetings within the town hall opening, and so on. And I think I know the answer to this question from what you said tonight before. People generally want to know when they can do various different things. What is the health analysis for this district in this town based upon what you know? And I know you've explained extensively that the COVID is still here and is not to be taken lightly. But if you could comment on that, I'd appreciate it.
No problem. And some of the things that people want to do right now are things that are perfectly or can be safe, can be done safely. So going to the park with your family, absolutely something that can be done safely. Outdoor activities along those lines, hiking, maintaining social distance, wearing a mask when you cannot, those are going to minimize the risk that you have to be able to enjoy the activities that we have and the town, resources can provide. I just want to remind folks, even as we start to reopen, there's something that always, as we're talking about this, that gets missed. If you look at page 4 of the general business rules for the reopening, it says, clearly that if you can work from home, continue to do so. If you can continue to stay separated, do that. For those with high risk, like the elderly, they need to stay home and stay isolated in order to stay safe. And all of those things, even as we're reopening, they still exist. So the safest way, to conduct a meeting of the public is the way that you're doing it right now. And it may be inconvenient at times for some, but the inconvenience is much better than having to provide for the risk associated with this. So, everything that I look at, can we do this in a way that's not going to provide a risk to those people in the environment that we're in? So dealing with the public by appointment, doing things a little differently online, these are all things that the town, I think, has done a wonderful job in, and continuing to provide services. but at the same time, providing them in a very safe way to their residents. I think we're going to get there. It is going to be some time. The things that we need to have in place to be able to get back to normal are the things that they're developing. So we still don't have a vaccine. We still don't have a viable treatment for this particular disease. And until we do so, really it's the social isolation and the community mitigation efforts that we've all put in place that's keeping everyone safe. So we can't really let those go lightly.
If I may, I know Mr. Chapman has relied heavily on your expertise, as he should, and on the state. My understanding from listening to you is that there is no definitive answer in terms of when things can open or should open. And is it up to the individual in terms of whether they feel safe enough to do things, as opposed to being told by government and whatever that it is safe to do them?
Well, I think there's a couple ways that I can answer that question. One, I think that the initial timeline that the governor and the committee had put together was put together very, I think, practically, because they had certain milestones in place, and they had a time frame from May 20th to June 20th, so that if something happened after they started to ease back restrictions and they saw numbers starting to go up, that it would allow for the reaction to say, okay, do we need to be able to pull back because the virus is reacting to the opportunities that we've given it. What we've seen since May 20th is, I think, a lot of pressure that has pushed those timelines and crunched them forward. And everybody right now is leaning forward, trying to say, okay, well, we can open on the 20th, or we can open on the 17th. And I don't mean to sound flip, but just because you can do something doesn't necessarily mean that you should. And we should really wait to see what the actual numbers are going to do. As I mentioned, we have the opportunity to be able to look across the country and see what happened in other communities as they removed the restrictions that they had in place. And what we've seen is that small increase that's starting to indicate that the virus is spreading again. So right now we're in a lull from all the restrictions that we had, and I'm waiting and looking every day to see what the numbers are going to do. And what I expect is for there to be a resurgence. Hopefully it won't be a terrible one, because people, if they continue to do the things like wearing a mask and doing the appropriate social distancing, we can limit that spread of the disease. But when you give this virus an opportunity, it's going to take it.
Okay, thank you. There's some specific things that I think Mr. DeMayo, who we may be talking to later, or Mr. Chapman would be able to answer. So I appreciate the input that you've given. Thank you.
No problem. Oh, you mentioned my expertise, and I'll just throw this out there. I don't want to toot my own horn here, but I've actually been planning for emergency preparedness for a pandemic since 2002. So my job started here in Connecticut right after 9/11, planning for smallpox vaccinations and training local health departments in doing those particular plans. I've been planning and working with health departments since that time frame on things like pandemic flu, anthrax, you name it. So there's a lot of experience in our district, both with myself, our assistant director, who is an emergency preparedness coordinator, and we actually have a preparedness coordinator who's been very involved during this particular pandemic.
Thank you again. That even gives me more comfort in your words.
You're muted, Mayor.
Can you hear me now?
Yes. I
Okay.
didn't figure I would quiet everybody down. That just never happens.
I didn't have a mute symbol on my screen, so I apologize. Counselor Pedrego, you had your hand up.
Yeah. Charles, you pointed out that one of the reasons that Newington is statistically higher than some of the surrounding areas is the number of, long-term care facilities, assisted living, whatever.
Mm-hmm.
And actually, Governor Lamont was in today's paper, I believe, said that he's going to be instituting a fairly detailed top-down study within every facility in the state to try and figure out what we did wrong, what worked, what didn't work, and what we need to do in the future, because he's predicting, or experts are predicting, a resurgence in the fall, and which will particularly hit these facilities, which again, we have a significant number in town. So do you feel that as other venues are easing restrictions, that there will be or should be any of easing restrictions within these facilities? Because again, they're going to be highly vulnerable to the second wave.
And I'm not going to make myself popular at this point, because really the only thing that's been protecting those particular facilities has been the isolation that we actually put them in. The more interactions that they have, really the more opportunities to catch the virus. And unfortunately, when they lock down, the virus still has gotten into several of them. We're learning about this virus every day. I think some of the things that have caused, the particular fatality rates that we've seen and the spread within those facilities has been lack of PPE, the personal protective equipment, for our healthcare workers within those facilities. And we've been working very hard with the state to try to assure that they get, what they need to be able to fight this disease off and to keep it from spreading from room to room, from ward to ward. So I think that that's one of the challenges that, as we're starting to see the supply chain pick up again, that hopefully we can address and start to stave this off. As we're looking into the future, I wholeheartedly agree with the governor. We need to do a very good after action report on this particular, outbreak within each facility and across the state. Let's learn the lessons, the hard lessons that we've learned, and share them so that everybody doesn't make the same mistakes or is able to make better choices as we move forward. As I mentioned, we are very far away from having, enough people within the community have had, touch points with this particular disease for herd immunity. So there's a lot of opportunity for this virus to continue to spread. What we don't want to have happen, and this is what I'm afraid of, is for this virus to continue to move on and run like wildfire, and then have to put restrictions back on. That right there, I think, would be extremely difficult. And it's one of the reasons, that I've always tried to advise caution and moving forward slowly, because it's much easier to go slowly and let the restriction go a little bit at a time than to try to reinstitute it once you've actually put it, let loose.
Thank you. All set, Counselor Pedrego?
Yes.
Okay. Counselor Minor?
Thank you, Madam Mayor. Charles, if you could give us any indication this is a sticking point for me specifically, is in-person meeting for us. We're a body theoretically of 12, if you count all the administrators that are there to assist. Is there any reason not to resume our in-person meetings and allow the public to view remotely, and anybody that doesn't feel comfortable to participate remotely, but at least afford us the opportunity to meet in person? Because it's occurring everywhere else on regular business makeup of having team meetings that are generally going to exceed the quantity of 10. And I'm just curious to your thoughts on that.
Well, I mean, my first thought is, can you conduct the business that you have to do remotely via this technology? Because if you can do that, that's absolutely the safest way to do so. The other thought that I have on this is, you know, the age of some of the counselors and everything else are ones that put them into the highest risk group. So, you know, they should still remain isolated at this point in order to protect themselves, you know, and their families. You know, I think the possibility of meeting, you know, you could do that. That is your choice. But it's not something, once again, that I would recommend if you can do your meetings via the technology. It is the safest way to accomplish it.
Yeah, the issue with the technology is, can it be accomplished? Yes. Is it very cumbersome? Yes. Is it sometimes, in my opinion, very difficult to do? And to have an open conversation, you know, we're using an electronic raise hand function and everything else. I think it takes away from our ability to interact and do our, you know, have our responsibilities, being able to work them more effectively. And I'm not encouraging anybody from anything if they don't feel safe by their demographic or family or whatever the case may be. Regardless of, as things open, yes, someone may be able to go to a restaurant, but should they? No, they probably should stay home if they don't feel like they should. And that's, I think, you know, the emphasis I'm trying to make is, I would rather have it as personal responsibilities that we choose to or we don't, versus being mandated that you can't. And that's, I think, the hardest part coming down to this is that to me is, you know, a tad bit frustrating.
Well, what I can say is this, you know, I can provide you with the risk that are there. I can provide you with recommendations to be able to manage that risk. And that's in large part what's been done thus far. You know, if meetings happen, you know, assuring that people have the appropriate protections, the face coverings and those things, helps to minimize the risk associated with person-to-person contact. You know, the best way to eliminate that is not to have that person-to-person contact. Ultimately, it's you as a town and you as a governing body that can choose to do this. My emphasis is to choose to do it in the safest manner that you can. If you can conduct business in this way, this is the safest way to do so.
Okay. And a follow-up to that, as we get into normal business operations for other town departments, I'll just use the library as an example. To go into that facility, at what point do you envision them being able to operate safely? And are there precautions that we currently do not have that might be something we should do in order to be able to open that facility up? What I'm thinking in regards to that would be a day porter that is, you know, spending their day cleaning that facility or all of our facilities as we open up that would not normally be done. Is that something that's realistic? Is it, you know, the misting process that's being done in the town hall proper, the new building? Is that something that could safely be accomplished to allow patrons the opportunity to come back in? And again, if they choose not to, then that's fine. Or another one would be, you know, playground equipment. Is there a reason why we can't sanitize our playground equipment? It's just, as I hear, you know, lake compound opening up and Quasi opening up to, you know, 25% capacity,
which I think is a mistake.
Yeah, and I wouldn't necessarily disagree, but somebody's saying that's safe, and I'm just curious to if there's anything we can accomplish that. That's all.
Well, and I agree with you. And trust me, I mean, as a public health professional, I would love to see all of those facilities like playgrounds for the kids, ball fields, all that open, because they provide an opportunity for exercise, for healthy activity. You know, it goes against my grain to be able to have to restrict those types of things or to recommend the restrictions of those activities. You know, the challenge is, can we do that safely? Now, you mentioned the library, and the challenge that we have with the library is with shared resources. So the ability to be able to share those resources within the community, not knowing what the health status of somebody who's going to handle it next, and not having a good way to assure that it's sanitized and that that particular virus isn't hitching a ride from one place to another. And it concerns me especially because a lot of times, especially with books, they're very tactile. You're touching the book, it's close to your face. It's a good opportunity for that virus to travel. So that's one of the reasons why I think libraries were a little challenging with respect to this. Can they start to be opened in a phased way as we move forward? I think so. But, you know, once again, I think that we have to look at where we are and can we provide that service, you know, in such a way that we can minimize the risk associated with it. So, you know, I believe currently the curbside pickup is underway in all 4 of our towns. So there are actually patrons can order books, have them brought out to the car, and be able to utilize them along those lines. So I think that's a good compromise. There are some services that, you know, I've spoken to all 4 of our library directors as they've started to look down the line at trying to open up and what do they need to have in place to be able to provide the services that they want to provide. So we're going to continue to work with them to be able to do that in a responsible way.
Okay, I think what it comes down to for me is if you look at, you know, a lot of our national retailers, be it national grocery stores or home improvement stores, where they've stayed open the entire time and they're multi-touch surfaces as well. So product comes in off a truck, it gets placed, you know, by the staff inside and it's being handled. And I'm just questioning what makes that, you know, is it different or is it not different, and what we can do. I believe for
the library, it is different because a lot of the products that you're buying at a library or buying at a big box store or whatever, you're not having the duration of contact that you have with a book. You know, it's something that you spend an hour or 2 hours with, and usually at very close contact to the face. And that's not something that's typical with other products. And I agree with you. I mean, I think that, you know, even now within some of the commercial settings and things of that nature, as we continue to go into them, there's risk associated with every interaction that we have. And I think that you mentioned, you know, it's a personal risk. Well, yes and no, because as we take that risk, we also have the responsibility to protect those that we come into contact with after that point. So assuring that we're doing that and that we're not continuing the spread of this particular disease is my concern.
Right. And to just close out with one final comment, the facilities that appear to be impacted the most that I'm familiar with in Rocky Hill and in Newington are both rehabilitation facilities, more so than long-term care facilities. And my concern initially, when I had asked for, you know, specifically where the hotspots were basically influx of patients coming in from the hospitals into these rehabilitation facilities, that there's a constant turnover that may be a week, 2 weeks, 6 weeks, depending on their level of care needing to rehabilitate. And if you've noticed that those facilities specifically versus more long-term care facilities that don't see a lot of turnover in patients, if you noticed the difference between those types of facilities?
Not very much. I mean, what we see is consistent across the long-term care facilities and the rehab facilities. Both of those congregate settings are really, I think, opportunities for the virus absolutely to travel, and it's taken that opportunity. So it's pretty consistent between the two of them. I don't have a numbers to be able to point to the individual pieces. I haven't delved into it that deeply yet. But you know, I've seen it in both cases as we've actually followed up with both the cases and the deaths within those facilities.
Okay. Thank you, Charles. Thank you, Madam Mayor. Appreciate it.
Thank you, Councilor Minor. Councilor Nagel?
Yes, I want to follow up with some library things that Mr. Minor has mentioned. One is just a brief statement that the library is, while they are taking books that people have used to return, they're safely being put in an area in the library for, I forgot, the certain amount of days to get the virus, if it is on there, to die or fall off, whatever it does, before those books are allowed to be put back into circulation. And also, many of the things, including possible additional sanitation and also products that would be used for COVID prevention in the library as well as other places, does all that expenditure come under being reimbursed by the state? Because I understand Lamont has put aside a sum to go to municipalities that would help to prevent COVID. Can you answer that one, Charlie?
Well, for the towns, just like any emergency that you deal with, the possibility for reimbursement through FEMA does exist, and they do reimburse for certain things up to 75%. So there is some funding available out there for reimbursement. It is something that you have to put up front. For the health district at this point, we've been given a total of $51,000 to actually, it's almost like a bank account that we can draw against, and it's supposed to last us until March of next year. I can almost guarantee you that that won't be the case, because it's really a pittance when you're looking at what we actually would need to be able to do the things that I'm anticipating that we're going to need to do in the future.
Okay, thank you.
Okay, I don't see any other questions, but Charlie, I just want to bring up a sticky topic, and I, ultimately, as you mentioned, this is policy, so we're going to have to make this decision. But one of the biggest questions I'm getting is that the governor had stated that daycare facilities can open with up to 50 children at this point, and correct me if I'm wrong, I think that's how I read it. And so we're getting a lot of pressure from our parents and families in town regarding summer programming and camps. And I don't know the specific regulations regarding camps, but can you speak to that at all, or what your recommendation would be?
Well, I mean, one of the big challenges that we have with respect to this disease is just not knowing enough about it. We've only had less than 6 months of exposure to it to learn how it travels and everything. So even with the guidance that they put in place that says groups of no more than 10 and trying to limit the size of programs, the challenges that I see with respect to that is the virus doesn't always present in ways that we can quantify. So for example, you don't always have a fever associated with this. You don't always have a cough or obvious symptoms. And the challenge that we see with the camps and things of that nature is kids themselves, I'll use a good public health phrase, they're wonderful vectors of disease. Because they really do, exactly, they really do, spread things. And a lot of it is things because of hand hygiene. The challenge with keeping face coverings on children, the ability to limit sharing things, and all of that comes back to that camp scenario. Because those are all things that in a camp scenario you're wanting to do. You're wanting them to share experiences. And the challenge of being able to do that, I think, is what leads us to say, is this a necessity? And if it's a childcare scenario, that's one thing. But some of the programs are an hour long, 2 hours long, and that's more of a learning thing. That's more of a entertainment opportunity. And those are things that I think that we're going to have to look very hard at. And trust me, Bill DeMayo and I have had a lot of conversations about the programs and everything else. And, it's not something that I take lightly in being able to recommend against. I think that once again, we're living in a much different world than we were in January, because, we have to really take the opportunities that we can to do things differently. And I think I have to congratulate Bill and Newington, because they were the first ones that stepped up and said, you know what, this is not something that we can do safely. And we don't think that we can do this without a risk to the children that we can really control. And we don't know enough about this virus yet to be able to effectively control that risk. That's one of the reasons why schools let out and didn't come back, is because we don't have the ability right now to be able to control, the virus within that setting. We don't have enough. We just don't know enough about it yet. So, at this point, I think that I have to stick with my recommendations. If you choose to do that, if that's a choice, being very strict with how they cohort and keep groups together, because having one person, one child contract this disease could wipe out an entire program quickly, because of the ability to have to quarantine and isolate. And then you're back to square one, because the parents are going to have to stay home anyway.
Right. Okay. I guess I was trying to make you be the heavy there, but
No, I can be the heavy. I mean, my once again, if this was my decision on this one, I would say, virtual summer camp is a wonderful thing.
Okay.
And I would say, that there are childcare facilities that are out there that are providing childcare, and to be able to look for those opportunities. There are camps, there are some camps that are operating. For the town to take on that liability, I think, is a challenge.
Yeah, it's such a struggle because we're just getting, the clear message from you is that it's not safe to consider this yet. And it's not, we don't know enough about this yet to make these decisions really. But yet when the governor sends a message out that daycare facilities can open with 50 kids, it's difficult.
I know. And I'll be honest. I mean, I don't agree with what is being put out at the state level. I don't, because I don't think that it's being led by public health measures.
Mhm.
It's being led by economic measures, and those need to be considered. And that's your job as policymakers, is to have to consider those things. As a public health professional, I see the risk and I see the associated outcomes. And from my perspective, I think that we're rushing into this. And I think that having the opportunity to take this slower is the more prudent path.
Well, and I'll tell you, from my perspective, I'm, as I mentioned, I'm an educator. So I'm looking at what the CEA guidelines are too. The CEA is saying very, very strictly that if we are to return to school, the measures that need to be in place are small groups of children, alternate busing, different schedules. And there's so many restrictions put into place that they're so contradictory in terms of what the governor is saying versus these other resources you included. So we definitely have to really be careful and cautious moving forward. Thank you.
You're very welcome.
I don't see any other council hands. So thank you, Mr. Brown. You did a wonderful job entertaining all of our questions.
Well, at the very least, I've become known as a bit of a buzzkill with respect to these things, and I've taken on that moniker pretty well. But I am just like you. I'm looking forward to the day where we have a vaccine, and that we're able to provide that to all the high-risk groups and to everybody, and to get back to the way things were before. Boy, do I want to go to the gym, let me tell you.
All right, I got to take it back now. Mr. Minor's got his hand up. I'm sorry. I thought I was letting you off the hook. Go ahead, Chris.
I should have kept my mouth
No,
shut.
this is just an end all. Mr. Brown, would you be amicable to coming back maybe next month, as we've got a few weeks behind us of phase 2, just to maybe relook at things?
Oh, I'm at your call. I mean, I am willing to come back whenever you guys need me.
Okay.
So that's not a problem, Mr. Bonner.
All right. Thank you.
Perfect. Thank you.
All
right, folks, we'll move on to our next item on our agenda, which is the Mill Pond Park Pool PBC Public Building Committee creation. We had discussed this at our May 12th regular town council meeting. We received a presentation on proposed improvements to Mill Pond Park Pool. We also discussed briefly at that meeting the possible creation of the Public Building Committee and what that would look like, and that is attached in our packets this evening for our review again. So I will open it up for discussion. Okay, nobody's talkative tonight. So the resolution that's in our packet to build this committee, or form this committee rather, does show two Newington Town Council representatives, one Republican, one Democrat, two Board of Parks and Recreations representatives, one Republican, one Democrat, and then 3 members of the public, 2 Republican, 1 Democrat. That's the current proposal. I would look, oh, I'm sorry, Councilor Donahue, go ahead.
Yeah, I mean, I just want to go on record as saying, just because we're going to, vote on this building committee does not mean in any way that it's 100%, a go. This is an exploratory committee. It's not, we're not saying that even this, is a priority. We're still waiting for our facility study to come in. So, I agree with starting the building committee, but I don't want any misconceptions that we're doing this building committee because it's a definite go.
Right, okay.
Uh-huh.
Councilor, Deputy Mayor Bedrejko?
Yes, I'd like to kind of piggyback on what Councilor Donahue said. I agree that there may be funds, coming. I agree that certainly our pools in town need some definite attention. And it's a good time to begin to prepare and think broadly about what our priorities are and what type of projects are going to contribute to, resiliency of our community. But we also have started a process through the facility study where we're going to get some good input onto exactly what the condition are of other facilities in town-wide. So we're going to be asking taxpayers, I'm sure, because we all know that maintenance has been kind of deferred for many, many years, much too long. We're going to be asking taxpayers to fund some pretty important projects with less money in their pockets, and quite frankly, I'm convinced less money being available from the state and from the feds. I mean, look at the amount of money that's going to be needed for COVID, for some of the other big problems that we have as a state and a nation and a town. So I will be supporting forming a building committee, but I just want to make it clear that I don't have the confidence to say that should this automatically means it's going to jump to the head of the list if and when we put items for referendum. I want to get an overall understanding of what we have in terms of infrastructure and the results of the study before we can put anything before the voters. And there, again, there's going to be less money for us to deal with, and we got to make sure that our priorities are in line with what the needs are. So yes, we can go forward with the building committee, but we need more information before we put anything before the voters outside of Anna Reynolds.
Thank you, Councilor Bedrejko. Councilor Minor?
Thank you, Madam Mayor. If I would, just echo both of the previous councilors, the only thing I would say in addition would be that historically, coming off of difficult economic times, it seems to be that there appears to be a lot of shovel-ready projects being sought just from the standpoint of reinvigorating the economy. And that seems to be core money that over history has shown that tends to happen. And with the formation of this committee is nothing more than just trying to create a little bit of a jump start towards getting an end product together that might be a viable project to put forward to the community for referendum. So I would also support moving this forward. Thank you.
Thank you, Counselor Minor. Counselor Menke?
Yeah, I would also support moving the building committee forward with the caution that I would like to see what the facilities study has to say to make sure this is the number one priority. There may be something else we aren't even considering at this point that will come out of that report that is going to be a more pressing priority. And as far as being shovel ready, I don't see this being ready to go to referendum in November. And frankly, I think if it were to go to referendum in November with Anna Reynolds, we would have something would get defeated because it's a lot for the taxpayers to take on all in one fell swoop here. So I'm not sure this is going to be a shovel ready project because it still has to go to referendum, no matter how you slice it or dice it. And I'm not sure we're ready to put two spending referendums on the ballot in November with all the other economic uncertainty of the next couple of months.
Thank you, Counselor Menke. Counselor Nagel? Counselor Nagel, you're on mute.
There, can you hear me now?
Yes.
Okay, I would concur that this resolution should go forward. I would also like to point out that there are other needs in town, other committees, specifically the library, that has been formed, and there are other needs that we may very well want to have committees for or to look at that may also come under the category of shovel ready if and when those monies do become available. And I'm also looking forward for that facilities committee to give us recommendations, to give us a clearer idea as to where this and other projects should lie in terms of the real needs of the town.
Thank you, Counselor Nagel. So I would ask that the motion be read into the record. We can certainly continue to discuss, but would someone be willing to read that motion for us, please? Counselor Anist?
Sure. Resolved in accordance with Article 10, Section 8-39 at Sync Project Building Committees of the Newington Code of Ordinances, the Newington Town Council hereby establishes a Mill Pond Park Pool Project Building Committee. Said committee is charged to work with the town manager and/or his or her designee and any other appropriate town staff in the oversight of the Mill Pond Park Pool Project and related activity. Such improvements shall comply with the appropriate sections of the Fire Code, Health Code, Building Code, and OSHA regulations of the Americans with Disability Act, and any other health and/or safety code regulations currently in force. Be it further resolved that the Mill Pond Park Pool Project Building Committee shall be comprised of 7 members, of which 2 shall be representatives of the Town Council, and 2 shall be representatives of the Board of Education, and 3 members from the public. Be it further resolved.
Counselor Anist, Board of Parks and Recreation. I think you said Education. I just want to make sure it's read correctly. 2 representatives from the Board of Parks.
2 shall be representatives of the Board of Parks and Recreation, and 3 members from the public. Be it further resolved that the Newington Town Council hereby appoints the following members to the Mill Pond Park Pool Project Building Committee, which there are none at this time, correct?
Correct. Okay. Is there a second?
Second.
Seconded by Counselor Camillo. So we'll just continue with discussion now. I see Counselor Camillo's hand up.
If and when this passes referendum, if we don't have the money coming in from the state, we don't act on it. And the public needs to know that too, just like Anna Reynolds. It goes to referendum and the money's not available, depending on what happens with COVID, we may not be able to push either forward. So, but it's a good thing to know what the public wants, and maybe we can put both of these to referendum at the same time. I know you don't think it'll go, Tim, at this time, but just an idea. This may be the year to do it. And who knows, all of a sudden we get money from the federal government and the state at the same time. Just a thought. I know.
Thank you. Any other council discussion on this? Okay. Susan, if you would, roll call vote, please.
Sorry, I was muted. Counselor Annis,
Yes.
Counselor Braverman,
Yes.
Counselor Budraco,
Yes.
Counselor Camillo,
Yes.
Counselor Donahue,
Yes.
Counselor Menke,
Yes.
Counselor Minor,
Yes.
Counselor Nagel,
Yes.
Mayor Del Buono.
Yes.
9-0.
Wonderful. Motion passes 9-0. Mr. DeMayo, I know you're listening. You have a new building committee. Thank you, everyone. Next item is Town Hall project update, which I believe that's you, Mr. Chapman.
Yes, the project is moving along. We're still expecting to be moving in mid-July. I will just go through a couple of things. The town hall exterior is substantially complete now. So most of the exterior of the building is done. They're currently installing the screening for the upper roof on the top floor. That's moving along. It's almost done. Painting inside the building on all 3 levels is continuing. The vault for the town clerk's office is complete now. And lighting and so forth and painting will be ongoing. The grand hall ceiling with lights is substantially complete. The gym finishes are substantially complete. The wood flooring is ongoing. The community center drywalling of the interior partitions are ongoing. And prime and first coat of paint is ongoing. Site work, the Mazzicoli Way is, I believe now has binder on it. And they're doing topsoiling and so forth, and any other additional work outside. It's been ongoing for several weeks now. Carpeting will be installed at the town hall in a very short time. And the gym equipment and bleachers will be installed. There is a problem with the gym equipment and the bleachers. The subcontractor has been shut down due to the pandemic. The contractor is attempting to obtain a schedule information from them, but it still goes unanswered. So we may have a little glitch there. We'll know better once the contractor or the gym equipment provider talks with Downs, but I would anticipate that may not be completed prior to our move-in. We're still scheduled, as I said, to move in between, I'd say, July 15th until about the July 27th. And once we're in, then the demolition will begin on the existing town hall.
Okay, wonderful. Any council questions? Seeing none, we'll move on to our next item of business. Thank you, Mr. Chapman. The next item is discussion of town manager evaluation / hiring. The council had originally hired Mr. Chapman for a 6-month term in January and has completed an evaluation process, most of which was done through executive session as a personnel matter. The council has had an opportunity to discuss the evaluation and to consider a permanent position for Mr. Chapman. And we have asked the town attorney to enter into negotiations in that matter. I will open it up for council discussion. There is a resolution. I believe Mr. Kropinski has been working on one for us. Should we choose to move forward and recommend the signing of a contract for Mr. Chapman. I will say that typically there's a bit of a public process that would happen, and with the COVID crisis going on right now and our meetings being limited, we are limited certainly on what we can do. But from my perspective, Mr. Chapman has above and beyond proven himself over the 6 months that he has been in our employee, really 5 months now. I don't want to over exaggerate. He has done an amazing job of handling quite a few things that have come his way. The town hall certainly needed a lot of last minute work in making sure the project could move forward and is able to move forward. He has done that. He has done an amazing job of handling this COVID crisis and making sure that he keeps our town employees and our community safe. I could go on and on. I will open it up to the council so that everyone else can weigh in. But I think he's done an amazing job, and I will gladly support moving him forward for a full appointment. Councillor Menke, you have your hand up.
I do. I would also support moving him forward and hiring him full-time. He has taken us through a difficult budget year with actually providing the taxpayers some slight relief anyway. And through this COVID crisis, those are two big items that he's managed to steer us through in the last couple of months. And I think we need someone at the helm who can take charge of the town and get us through the coming crisis of the continuing crisis of the COVID and whatever else comes up. I think Mr. Chapman has demonstrated his ability to lead us, to lead his staff and the town employees, but also look out for the welfare of Newington. And I think those are important things for our town. And I would certainly support him as full-time.
Thank you, Councilor Mankey. Councilor Nagel.
Unmute. I would also like to support Mr. Chapman being hired as our official town manager. I concur with the mayor and Mr. Mankey about the outstanding job that he did. I was the chair of the evaluation subcommittee, and all the results and discussions that were done in the survey that was done prior to this whole COVID business that has made the job even more difficult, and he has done a wonderful job with that too. So it just adds to the very positive, and I do mean very positive results of the evaluation process that we submitted, not only in terms of the rating scales, but also the comments primarily were very positive, and it goes to show that indeed he would be a valuable asset to have as a full-time town manager, since he's done such an excellent job up to this point. So I'll be voting in favor of having him stay on.
Thank you, Councilor Nagel. Councilor Minor.
Thank you, Madam Mayor. The only thing I would say is I believe that Mr. Chapman has entered into a time in Newington that we have never seen before, that there has just been one issue after another that is, come across our tables and are ongoing. My only reluctance at all is what you alluded to when you first introduced the conversation, is not being able to allow public input. And unfortunately, with what we have to work with now, there really is no viable forum to allow for that. But with that said, I applaud for his efforts to date in trying to keep everything on track in terms of all the issues that are coming across currently to date. Thank you.
Thank you, Councilor Minor. Deputy Mayor Bedrejko.
Yeah, I'll be supporting this, obviously. And one of the things, beside an incredible work ethic that I've been impressed with, is this is really a hands-on individual. I mean, he's been, he's traveling, throughout the town, refamiliarizing, I guess, with the businesses, with the parks, with the streets, with whatever. He really wants to know what's going on, wants to get to the bottom of things, wants to get answers, and to me is truly interested in what people have to say. He's looking at staff, utilizing staff to not only what their capabilities are, but I think pushing them above and beyond, so that his staff can grow. And I attended one of his leadership training programs, and I was really impressed by the fact that there's actually, training going on of staff on, and getting communication going between staff, so it's not as siloed as before. So I think even though it's only been 4 or 5 months, I think some positive changes have already started to occur.
Thank you, Deputy Mayor Bedrejko. Mr. Chapman, do you have anything you'd like to add? We're sitting here talking all about you, but is there anything you'd like to add in terms of this item?
As I had said from the beginning, this was an honor for me to be asked to come back. This is my 3rd time now working for the town. And we do have a great staff, and we emphasize training and team building and working together. And I'm very pleased with the relationship that we've developed now with the Board of Education superintendent. And, you know, as was pointed out, I'm a hands-on guy. I like to be out there. I like to, we'll say, meet and talk to people, as we did just last week, going to every business downtown and discussing matters with them. So I'm honored to be here, and I want to continue to serve the community in the best way I know how. We're not always going to agree, but I think that over time you'll find that all of my staff will be stepping up to the plate, and we're raising the bar much higher than before. And I think it's a good thing for the town. And the town citizens, the response I've gotten from the residents and the business community has been outstanding. Seems like everybody's pleased that I'm back, and I don't want to let them down, including you guys.
I have no doubt you will continue to raise the bar. I've seen you in action. And I will say that while you continue to raise expectations and really utilize our staff to their strengths, which is what I've seen, the climate in town hall is happy. And so while you're getting the most out of everyone and you're really having high expectations, the employees that I have seen and that I have dealt with really seem to be very happy, and that matters. And so I appreciate the climate that you brought to town hall. I appreciate all your efforts. I really can't praise you enough. I'm amazed at what you've accomplished in such a short period of time. And the budget really was huge. Thank you, Tim, for bringing that up, because I didn't mention that earlier, but bringing in a 0% increase and a little bit of a negative was a huge feat for you to accomplish in just a very short time.
It was bigger. The negative was bigger.
We messed that up a little bit. I'll take that. I'm going to need someone to read the motion in. It is on our screen. Who would like to do that?
I'll do it.
Hello.
Resolved, pursuant to the section 501 of the Newington Town Charter, the Newington Town Council hereby appoints Keith Chapman as town manager of the town of Newington, effective upon the expiration of the current executed contract signed on January 21st, 2020. Benjamin Ancona, town attorney, shall draft a final agreement with the terms that are acceptable to both Mr. Chapman and the town council, and shall have said executed at once. A copy of the agreement between the town council and Keith Chapman will be placed on file in the town clerk's office.
Is there a second?
Second.
Seconded by Councilor Menke. Any further discussion on this matter? Seeing none, Susan, if we could do a roll call vote, please.
Counselor Anist,
Yes.
Counselor Braverman,
Yes.
Counselor Budraco,
Yes.
Counselor Camillo,
Yes.
Counselor Donahue, Counselor Menke,
Yes.
Counselor Minor,
I don't know if anybody just picked up on it, but it said the recording is stopped.
Yeah, let's pause the roll call vote for a second. James, are you there?
It is still running. Somebody else must have had it and stopped it, but it's fine on our side.
Perfect, thank you.
Counselor Minor,
Okay. Yes.
Counselor Nagel,
Yes.
Mayor Del Buono.
Absolutely, yes.
9-0.
Wonderful. Motion passes 9-0. Mr. Chapman. So
Congratulations.
please,
Welcome aboard.
congratulations.
I won't let you down.
Good.
All right, folks, we'll move on. I'm gonna try and hide this big smile I have on my face because I'm just thrilled to have Mr. Chapman at the helm from now until forever. Forever, Keith. Maybe not, but we'll go there later. The next item on our agenda is new business, and the first item under new business is the presentation of the Anna Reynolds School renovation project. And who do we have with us tonight? I see Ms. Brummett. Dr. Brummett is here, correct?
Yes, I am.
Hi, Maureen. How are you today?
Good evening. Congratulations, Mr. Chapman.
Thank you, Maureen. Thank you.
You're welcome. Yes, I am thrilled to introduce Chuck Warrington and John Coppolis from Colliers. We've been working with them since about April to get the ed specifications ready to go. The board approved them last evening. And tonight, we'd like to present to the town council some of their, a brief overview of what the project will look like. Excuse me, some information about the cost of the project and the timelines. So at this point, I'd like to turn it over to Chuck Warrington. He's going to take over the screen and present an overview for the town council.
Wonderful, thank you.
Chuck, give me one moment. I'll get the pause done and get you transferred over to a co-host.
All right, great. While we're doing that, good evening. My name is Chuck Warrington. I'm a director of project management with Colliers Project Leaders. You may be familiar with us at the Town Hall project with Mark Schweitzer, who's working on that. He's one of my team members with Colliers. So we're happy to be participating on Anna Reynolds as well, and hopefully expanding our relationship with Newington. I'm just going to share this. Can everybody see the full presentation there?
Yes.
Yes.
Yeah, it doesn't necessarily give me a good indication of which one. So yeah, so College Project Leaders, I think some of you are familiar, we're based out of Madison, Connecticut. We're an owners project management group, and as well as a commissioning group. We do specialize highly in education, both K-12 and higher education, both public and private. Myself, I lead our Connecticut K-12 division with OSCGR. So this project here is really under my bailiwick, if you will. And we have a lot of expertise with many different projects with the state, and leading and helping districts get through pre-referendum all the way through project closeout. So we're excited to be here. Make sure, okay. So again, I talked about our experience, and we are helping some of your neighboring districts: South Windsor, Weathersfield, Connecticut, Rocky Hill. We've been working with them, so we're really proximal to Newington with a lot of your neighbors, and throughout the state as well. But John Copeless is our senior project manager. He's been working with us and Maureen and her team to develop, evaluate the school, develop the educational specifications, and probably most importantly tonight's probably the budget is what everybody is mostly looking forward to getting to. And we've had a lot of success with developing budgets, and more importantly, managing budgets. That's really the big difference in making a project successful financially wise. We were hired in early April. We interviewed on the 3rd, and we started on the 8th. And since that time, John and other team members have been out at Anna Reynolds investigating and really evaluating the building. For the most part, is it a good candidate for renovation status? And the answer to that is yes. It's an older building. There was a wing added in roughly 2000, a couple kindergarten classrooms, and then the media center, if anybody's been there. The rest of it was done in the mid 50s or so. So it's been maintained well. If anybody's been through it, it looks great. However, a lot of that does mask some underlying problems, primarily your HVAC systems, the building envelope, the roof, the exterior walls. Some of them, the windows need to be addressed as well. But we've also been looking at the existing floor plan, evaluating the size of the building, because what's important there is we have to make sure we compare that to the enrollment and ultimately the space standard calculation. That is basically the calculation that the state says what they're willing to reimburse for, in a nutshell. We've been confirming the existing programs. Again, the space standards, we drafted the ed spec, a project schedule, which we have a snapshot of that if anybody hasn't seen it yet. Preliminary construction phasing in, and again, a preliminary budget for the project that we feel very comfortable with. On the next slide, I'm going to pass off to John to talk about some of the field investigation and what he found with our other team members.
Thank you, Chuck, and good evening, everybody. Again, the start of the project, we ended up initiating a review of the building. A couple of us from the office came out to the site, I believe it was April 11th, the exact date. And the reason I say that is because April 10th was a major rain event through the day. So going out to the site, we had heard of the issues with the existing roof system. And to be honest, expected to see a lot of signs of leaks and things that would be prevalent within the interior of the building. However, I was happy to notice and glad to report that for the most part, it was very dry. There were no signs of active leaks. I know there has been numerous attempts recently with regards to roof patching. So those have been successful, and at least for the time being, the facility was in a dry state that day at least. The other issues that we were looking at as far as the building envelope, in addition to the roof, the perimeter, the windows, the doors, some of those features of the building, which for the most part go back to the 1954 date when it was originally constructed, and just analyzing and assessing that. We also looked at the HVAC system, some of the plumbing components there obviously are a little bit outdated with respect to the bathrooms and things. And then also the challenges with storage. There's a lot of issues with a challenging ability for storage, specifically for the gym, as well as some of the classrooms and in general, throughout the school. So that's something else that was obvious during the walkthrough. And then finally, some of the other elements with respect to the site pertaining, or not to the site, but to the building, pertaining to the ADA accessibility issues and the ideal need to try to incorporate a new elevator to facilitate access specifically down to the gym location in order to avoid the circuitous route, having to travel all 3 or 4 of those hallways in order to get to that lower elevation. So that was another element that we looked at while on site that day. So the next slide, please, Chuck. So taking that information, we then ended up, taking the floor plan, which is what is depicted here on the screen, and assessed and determined what the existing facility was being used for and how it was being allocated. The yellow designation are the classrooms, specific classroom locations. The green is the central courtyard space, obviously. The blue are the administrative or teacher components. And then the pink elements are some of the administrative type support spaces, such as the gymnasium, the cafeteria, the music rooms, therapy rooms, and then also the media center. And art room, I believe, would be the last one on that list. And we took the existing facility, determined the square footage, and with that information, determined what the makeup of the existing floor plan was, and to use that to base whether or not the existing facility was acceptable, if you will, or capable of supporting the new ed spec that was going to be generated, and ultimately to determine whether or not an addition to the existing floor plan would need to be necessary, or if it was something that could be done within the existing confines of the building footprint. And then taking that same floor plan and sort of taking the color out of it for the most part, we then, in meeting with Dr. Brummett and with Jason and Lou, assessed the floor plan and tried to reallocate how exactly the spaces would be addressed and assigned. And for the most part, we were able to determine that, yes, this facility can exist with the existing parameters. And by shuffling some things around and looking at modifying a couple things here and there, we are able to verify that the existing school structure and footprint is adequate for the proposed new ed specifications and the potential new programs that are looking to be incorporated into the facility. Specifically, the preschool program, they are looking to bring 2 classes into that component, and that is going to result in shuffling a couple other existing room designations around. The 2 yellow rooms that are highlighted on the plan are designating the existing, if you will, transition or swing spaces that were left after designating each of those rooms currently. So it did provide us with the ability to say, yes, we do have the space within this existing footprint. There would be no need to make any significant addition to the facility. And also by shuffling a couple things around are ultimately able to meet the ideal intention of the new ed spec. And this is, as an example, the cover page. I'm not sure, to be honest, if you have received a copy of this or not, but this is the latest and draft version of the ed specification that was presented to the Board of Education. Initially, there was a version beginning of January, which had been looked at and approved. However, after being brought on board in the beginning of April, myself and Dr. Brummett and Jason Smith and Lou, we all started to tackle this and approach it in a little bit more of a detailed approach, and using a format that has been used in the past with the state and one which the state is very receptive to, expanded on the level of detail for each of the programs, for the different spaces, and helped to really zero in on exactly what would be placed where within the school, and confirm the fact that the existing footprint would be able to house all of the program that is intended for the new school.
Yeah, so just to opine, again, Chuck Warrington with Colliers, the ESPEC was approved last night by the Board of Education unanimously. So that portion of approvals from the Board of Ed is complete. With that, I don't know if Dr. Brum, if you have anything else to add for the EdSpec there.
No, I believe that we've spent the better part of the last 3 months, or has it only been 2 months, revising it, reviewing it, walking the school numerous times, conferring with Jason, and he has been conferring with his staff to make sure the ed specs are designed to meet the needs of the school within the existing footprint, other than the elevator. And, we had a recent review of our plans with the state OSCGNR and got some favorable feedback on the direction we're headed in. And I think, we're ready to move to the next level. So I'm sure everyone's eagerly awaiting the cost of the project.
Yes, so I'll move quickly to that. But a couple of these, the next couple slides are really important for, I think, everyone in the district to understand the criteria it takes to really maximize reimbursement, which is always the goal of every district, is to get as much reimbursement from the state as possible and reduce ineligible costs. What the first factor associated that is again what we call the space standard in the 8-year maximum enrollment. So the state of Connecticut, the spreadsheet you see to the left, uses a spreadsheet, and you can see that there's a chart there, and it looks at the factors, the grades that are going to be housed, and it assigns a square foot per pupil for each grade. We end up putting it in the middle of the chart there, where you can see all the different grades listed. And then we enter in the 8-year maximum enrollment that NESDEC was the demographer, and they provided us the specific for the school. And for Anna Reynolds, we're projecting an 8-year maximum of 443 students, which includes 60 pre-K students. That's an addition of a classroom from what they currently have. So what we do from there is, as John was alluding to, we already evaluated what was the existing size and confirming the existing square foot of the existing building. This, we're able to compare and go, what is a state, according to this calculation, willing to reimburse? Based upon the 443 students and the grades that we're housing, the space standard is about 53,160 square feet. The comparable area of the building is approximately 61,600 square feet. So as you can see by the calculation, what they're theoretically willing to support is less than what we have. Now, take into account special programs that we're going to be housing into the facility, some choice students I think we're going to be adding to, and the fact that it's an existing building. We feel confident we're going to be able to, the state's going to work with us to not reduce the reimbursement rate, because what will typically happen is they would take the ratio of the 53,000, 160 divided by the 61,644 that you see, and apply that ratio, which is about 0.86%. That's shown down here. It's a little bit foggy, but 86.24%. They would typically apply that to your reimbursement rate, which is currently 57.86%. But in this case, given our history and talking with OSCGR last week, we feel pretty comfortable that we'll get it. But until we actually have the waiver in hand, that's always a little bit of a risk. So we want to be transparent about that. Many districts in the past have assumed that they'll get it, and there's a process to get it. So we're well underway to do that. What that then leads into the next item is renovation status, or what you call renovate as new. The common term is renovate as new. The goal of this project is to renovate this project as new, which means it has the useful life of a 20-year building, brand new building, and all the systems, your mechanical, your electrical, your IT, your program, everything's brought up, all your finishes are brought up to like a new building, except what we're using the current bones of the building, which here, they're very good. You have CMU walls there. I think they were glazed prior, looking at walking through the school. So you have CMU walls that are demising the corridors and the existing classrooms. That's excellent from a security standpoint, having secure masonry for corridor walls. The size of the rooms are very good size. So we think we're a good candidate based upon past projects that we've worked on. What's important to understand is that there's two ways to procure renovation status, and it's not automatic. We have to apply for it. Again, many districts in the past, we worked with East Hampton, North Haven on their schools, and they had assumed they were getting renovation status because they didn't understand this process. So what we'll have to do is there's two ways to go about it. It's administrative approval, which we apply to OSCGNR, and that's Office of School Construction Grants and Review. And there's a letter that's about 9 bullet points that we have to prove to them. An actual licensed architect has to put that together and submit that to them for review. We're in the process of procuring some costs to do that and talking with one of the firms that worked on it to see how they can help us. And we'd like to go about that way, because when you partner with the state, that's always better than using notwithstanding legislation, which some districts have done in the past. And that office frowns upon that. They would prefer you work with them to achieve it. And then again, the other one is notwithstanding, where we have your local state representatives draft legislation to put into a bill that says it's granted renovation status for that. What renovation status does is it greatly reduces the ineligible costs. Every project, no matter if it's a new project, renovation, it has ineligible costs for different variables. I'll be more happy to opine on those. But in this project, it'll go in as what they call an alteration/extensions, primarily alteration. And with that designation, which is statutory, there's a list, about 5 pages of ineligible costs that come into play. By achieving renovation status, those go away for the most part, and a majority of those costs become eligible. So again, it's very important to understand that we have to apply for it. It's not going to be automatic with the application. If you look at estimated ineligible costs down the road, if this moves forward, it may look high at first, but once the renovation status is achieved, those get reduced greatly. So we also took a look at, so now we're getting kind of really close to the budget. And when we're looking at the budget, we have to look at construction phasing and schedule. And so this here slide is it's a draft form. We haven't finished it. But the goal here was to determine, can we renovate this school in place without using portables? Because portables are just, frankly, a big waste of money. If you need them, you need them. And our discussion with the team was, can we find approximately 6 to 8 or create 6 to 8 classrooms that the contractor can eventually renovate at a time and move throughout the building in a systematic way that we can avoid using portables. So we looked at it at a high level. We reviewed it with a couple of our colleague construction management firms, and we feel comfortable we can do it. We've done it in the past as OPMs in multiple districts. It's a little bit of a stress on the school, but I think with the leadership at that school, I think we can handle that very well. Jason's great to work with, and I think him messaging to his staff, we can achieve that. But the key thing is hiring the right construction management firm, the right team, the right architect, hopefully OPM, in doing that. So we're looking at about 18 months. We estimate it might grow a little bit, but that's what we're estimating right now. About a year and a half. I'll show you the schedule. Again, using the existing classrooms for swing space, maximizing 2 summers to get a lot of the work done. If anybody's heard the terminology summer slammer, basically we're just kicking everybody out of school and getting as much done as we can in the 7 or 8 weeks that we have before school returns for that. The schedule, so the schedule here, this is a high level schedule, very linear. It has really your 3 basic phases of design, bidding, and construction. The red bar you can see, actually it's a little bit outdated. This is mid-May, we're a couple weeks ahead now. We're working on the grant application at the top in that tan color. The following months, assuming if the council approves the budget and able to go to referendum and I think November, we would support pre-referendum services, support the project, sell the project, present, et cetera, to the public. Hopefully a successful referendum in November. And at that point, that's when it starts the project in earnest. That's when you really hire your architect and your team to start designing and working on the projects. Anything prior to that is ineligible. So any costs prior to that date are ineligible with the state. The red line here you see in 2020, that's the deadline for the grant application. It's statutory that grant applications are due June 30th of each year in order to be considered for the priority list, which is the legislation to approve school projects for the following year. So we're on track to do that, assuming all the approvals go through okay, but we've already gathered much of the information to file that on June 26th, I believe is our magic date we're going to submit for that. From that date, a year later, we would anticipate hopefully a grant commitment, which basically says the state approves the funding for the project. I think this project's in good standing. I don't see any reason why we wouldn't get on the priority list based upon our discussions with the state. And then from the grant commitment, which is in basically summer, July 2021, depending on when the legislative session ends, it's usually the last bill that gets approved is what we've seen. From there, you have 2 years to start construction. That's a requirement. We've never had a problem meeting that date as long as the project's managed properly. The schedule, the team, and the whole process itself is really important to manage it properly. But in November, we do an architect selection. It's about 2.5, 3 months. It's a quality-based selection where you do RFQ, RFP, request for qualifications, request for proposal. Takes a couple months, get the contract signed with the architect. That's something that Colliers, we do. We have our own contract, so we can greatly assist with that. We do it all the time. And then the design phase will be about 12 months. This is relatively a simple project for the most part compared to some other ones, but it does have its details that need to be taken care of, and the process has to take place. We do the schematic design, estimate, the design development, and construction documents. For those who are familiar with your town hall, is probably somewhat of a similar timeline for most projects, but we have to go through and estimate and make sure we're tracking on budget. And then we anticipate in late winter, early spring, going out to bid. And that takes about 2.5, 3 months as well. We would anticipate using a construction manager for this because it is a occupied phase construction. To use a general contractor, you don't have as much flexibility and control on the phasing and the management of the project. So we'd certainly recommend that based upon the scope. And then you can see in June of 2022, that's that first summer when we would start. We want to take advantage of that. And in that time frame, we would do enabling work, making the temporary classrooms in the media center, and getting ready for the fall so that we can start phasing the project and doing the renovations within it. Then again, another 18 months, year and a half, we would expect to complete at the end of 2023. And again, this is a high level analysis. It might modify a little bit, it might change slightly. But based upon our experience with other projects, we think that's a good schedule. We'll have to push it and make sure we have a good team to do that. So the fun part here is our project budget, our proposed project budget. So with Colliers, as I've noted before, we've done a lot of school construction projects. We've budgeted school projects. We have not gone over budget for any of the ones that we've worked on, that I know that I've worked on. We've developed budgets for some of your neighboring districts. South Windsor is one we always reference. It's a very popular program of the state and very highly regarded. All those projects have been under budget and on time, and we're out for the fourth school that passed it to 80% by the referendum because of those successes. So the preliminary budget, the overall estimated budget is $35.5 million. That's total project budget, and that terminology is very important to understand. That includes everything: your construction costs, furniture, fees and expenses, and contingency. The construction costs, which is obviously what the contractor is going to do, the site work, the building work inside, is what we call hard costs. The remaining are what we call soft costs, and those two combined make the total. So the total estimated for new construction is $27.5 million. So how we basically we have a detailed budget format that we utilize. We take the existing square footage of roughly 65,000 square feet, apply a cost per square foot to it based upon past projects and talking with other colleagues and professionals. We also look at hazardous materials, and based upon the era of this building, we apply a certain cost per square foot based upon historical values for asbestos abatement, PCBs, and the like. We also include a certain percentage for site costs. On this project for the site improvements are going to be relatively modest. We're not looking to, at this point in our discussions, do a total overhaul of the playfield on the lower side. That's very close to the school. We're looking to better some of the vehicular movements at the front of the building. Anybody who's been there, there's a electrical transformer that's in the way, and there's a bottleneck, so we would want to improve that, as well as some specific improvements around the playground, some drainage that we looked at the other day, the courtyard. Again, very select. It's not a complete overhaul of the site. So we assign about a 12% site cost against building there for that. The other one's FF&E. That's your furniture, fixtures, and equipment. That's desks, chairs, filing cabinets, computers, network equipment, if necessary, for the building. That's a separate phase that we procure through multiple different vendors, either through state contract or bidding. And we use historical data on a cost per student basis for that. And we're estimated about $1.7 million for this project. Total estimated fees and expenses. So this is the architect. This is third-party code reviews, owner's project manager costs, hopefully, construction manager costs, printing, inspections, everything that it takes to support the construction, permits, builder's risk insurance, as well are included in this. Commissioning agent would be required in renovation status as well to meet Connecticut high performance. That totals about $4 million for those fees. And then the really important one is the contingency. And this is collectively owner's contingency. This is your contingency. It's not the CM contingency. If anybody's familiar with construction managers, it's your contingency that will cover any unforeseen conditions, betterments, we'll call errors and omissions on behalf of the architect. Hopefully those are minimal if we hire the architect, but it does happen. And then any other building official or fire marshal requests during construction, they always come up. That would cover those unforeseen costs, if you will. So those combined, again, are 35.5 total project budget. We estimate the district share to be anywhere from 16 to 19 million. Now, what goes into that is a couple of factors. One is we're assuming we'll achieve renovation status, and we kind of talked about that before. And by assuming that, it means our ineligible costs are less. We assume about 4 or 5% ineligible costs when we do that, and then as we take those ineligible costs, the state will take those right off the top, kind of similar if you're going for funding for, our kids going to school, any grants and stuff, they take them off the top and they look at the remaining eligible costs. And that eligible cost is what they'll apply what's currently 57.86%, apply that to it. The range also accounts for the space waiver. The higher district share of 19 million assumes we wouldn't get a space waiver. We think we're going to get it, but again, we're being conservative. We want to make sure we're not hiding any numbers or disclosing anything that's not potentially true. So that is 16 to 19 million. And we have, since this presentation, Colliers has developed a cash flow analysis that we've given to your director of finance on a month-by-month basis using that schedule that we showed you. So we basically take all these costs, we spread them out over the entire course of the project, and it gives us a monthly summary in a spreadsheet that we anticipate how much costs per month that you'll have to pay out. We also provide an estimated reimbursement amount because once you receive a grant commitment, hopefully in that summer of 2022, you can start applying for reimbursement requests from the state on a bi-monthly basis. So we've always accounted for that. And they also, they hold back 11% on those reimbursement rates. So that comes into play. So that is the project budget. And then again, the last one is the status of the grant application. Our enrollment projections are done. The local resolutions are completed. Hazardous materials investigations. We've had some preliminary reports. We looked at that and accounted for those. A phase 1 environmental site assessment. That's a historical look at the site, what it's been used for. We didn't see anything pressing there that would cause concern for the budget. Approval revised at specs. Those are done. We should have updated it, but those were completed last night. So those are done. And then the next steps are authorization of the project budget by this council here and authorization to hold a referendum in November because the state needs to see that the governing body has approved holding a referendum for the project for which we have to report the results by November 15th in order for that to be put on the priority list. Because you're referendum town, you can do that. And then, just again, approval of the budget, schedule, and estimated district reimbursement. So with that, that's our presentation. I apologize if I was long-winded, but if there's any questions, be happy to answer those.
Thank you so much. I'm sorry, I'm still writing notes.
Back to the budget here, because it's probably the most important one. So.
All right, so council, we're opening it up to discussion or questions. Deputy Mayor Bedrejko.
Yes, thank you for that presentation. It was informative and quite, comprehensive, but yet understandable too. I have actually 2 questions. First of all, you did mention that there is going to be abatement issues and, possible PCP. I know there's dust and mold, whatever. But the students are going to remain within the school. I mean, I actually I was anticipating, having, portable classrooms, whatever, but I'm assuming that you've assessed the situation and even the noise and whatever and the disruption are you going to try and schedule most of that for the summer periods? I'm just curious how that will work.
Yes, so Department of Public Health will not allow us to abate. We can demo, which we call clean demo. We can only abate during the summer when the kids are not there. They will not allow us to abate in this situation while the students are there. Most likely, we've done it in some cases, but there has to be very hard barriers. Bill Stapleton is from the Department of Public Health. He's very, very good, and he's very, very stringent and adamant when it comes to the schools, which he should be. But you can take a lot of faith in what he does and what that department does. But we'll probably try to take advantage of those, what I call those summer slammers, those summers that, or maybe Christmas break when the kids are gone. We may work double shifts. A lot of the work's going to be inside as well. So that as far as the noise goes, we're not doing any really heavy demolition. If anything, it's going to be more selective and less, I'll say, noisy. And that's kind of a relative term, I guess. Depends on the perception. But most of the abatement work would be in the summer or during breaks and after hours, but not when the kids are in school, most likely.
Thank you. And then I have just one more question. Who'd have thought like a year ago, we're dealing now with this pandemic, and there's an awful lot of very much uncertainties about how schools are going to look when and if they open in the fall, in terms of class sizes, in terms of what the future of our schools are going to have to look like, and how within your design, how flexible, because we're spending a lot of money on this, is there flexibility for as situations or even trends, there was open classrooms, closed classrooms, this and that, pandemic, you need social distancing, but then you need small classes, whatever. How flexible are you building it so that the school will be able to function and adapt to whatever situations come around in the next 25 to 30 years?
Great question, Gail. So obviously we don't know what that landscape's going to be. Within Colliers, we're talking with our other colleagues in Rhode Island and Massachusetts who are both in education and healthcare. So just from gathering information, we've been putting together a database of concerns, which they vary from social distancing, remote learning, touchless operations. That's one that's big in healthcare that we're kind of keeping track of so that we can be a resource for projects and yourself. As far as the physical space within the building, because we're not adding on, we're going to be using your existing classrooms. So majority of the classrooms they're going to get basically a facelift. They're going to get new mechanicals, new HVAC systems, indoor air quality is going to be greatly improved. That may be one area where those systems may get a little more complicated. I'm not sure yet. For example, the nurses suite, we may provide dedicated exhaust from the nurses suite. So if there is a student or staff member for that matter, that is feeling ill, maybe they're put in an isolated area where the exhaust is going straight out of the building versus being recirculated. But as far as flexibility, there is some, but within the physical parameters of the building, we're kind of restricted. The only thing we're adding is a new elevator to go from like the gym level down to up to the cafeteria level, where there's about 14 stairs if anybody's been in there. But we're going to be keeping an eye on that, and I think a lot of technology, again, touchless operations will play a big part in that. Our mechanical systems. So there's some flexibility. It's kind of an open-ended, kind of a difficult question, honestly, but we're going to be keeping assessment of that. As well as the architect. When you bring the architects on board, we're the owner's rep, we don't design it. The firms that will be applying for this are very up to speed in this. They're all keeping track. There's been a lot of forums within we call the AEC, the architect, engineering, construction world on these trends. So I apologize if I'm a little vague with that answer there, but it's certainly at the forefront.
Thank you.
Thank you. Councilor Minor.
Thank you, Madam Mayor. If I could just bring up one thing that I think is important, it's something I've heard repeatedly from quite a few different residents, is why renovate as new versus, well, why don't we just do a partial restoration or renovation, or why don't we build something brand new? And I wonder if you could speak to the varied reimbursement rates from one to the other, because I know they tend to be pretty extreme. And that, I think, is also a driving force in terms of how you've looked at this as a net project cost to the town of Newington to come to, the pathway that we've chosen to date from the building committee standpoint.
Sure. Yeah. So I'm going to kind of take those in parts, and I may ask you to repeat the question if that's okay. The first one is reimbursement rates. So we'll talk about that first. So there's two reimbursement rates for all the districts for school construction projects. One is new construction, and the other is alteration in the renovations, roof replacement, code upgrades, basically everything other than a new. The new reimbursement rate is 10% less than the renovation rate. So your new rate would be currently 47.86%, rather than 57.86. So that clarifies that between those two. That's very simple. It's statutory. The state OSCGR doesn't. It's a formula that's controlled by SDE. It's not controlled by them at all. So that's that application. As far as doing, I'll say, moderate alterations, if you will, versus a total renovation. In our scope, we frankly, we didn't look too heavily in the alterations based upon what we're assigned to do under our task. It was for renovation. However, we have looked at that in the past, and when you do alterations, roof replacement, window replacement, your mechanical systems, for example, mechanical systems in an alteration are not reimbursable. That can run you in the millions of dollars if you were to do a total upgrade to your boilers, put in new air conditioning, condensing boilers, circulation lines, et cetera, that are, apologize, I'm getting a bug in front of me, that are ineligible. So a majority of those costs in I'll say that alteration project, where some of them you're not even going to apply to the state. You won't have an application available for it, will lie onto the district. Now, what that value is, I don't have an exact number for you. We haven't dived into, assessing, I'll say, capital improvement projects, if you will. So you may do a roof one year, you may do window replacement another year, some abatement another year. We haven't assessed that. But you could, if you look at a project like this, you could probably get into 10, 12, $14 million, depends what the scope is. And we haven't done that. So when you compare all those, and at the same time, you're not, in those projects, typically you're not upgrading your facilities to 21st century learning. Your security measures may not be as robust as in a renovation project, like hardening of the entry points is in the new SSIC requirements. And that's a requirement for renovation status. So again, you might get some reimbursement, but maybe not all of those. So it comes down to, I think it's really is what's the value for the dollars you're spending maybe in an alteration project versus the dollars you're spending in a renovation project. And it's very subjective as to, are we getting more bang for the buck? And I'm kind of simplifying that for that. So, and then as far as a new versus a renovation, a couple things come into play there is, if you build it on the existing site, that site's got a lot of topography, obviously. The only place you could build is really down on the field based upon what I've seen. So you'd have to build it in place. And we're doing this in South Windsor, but those sites facilitate building on the same site, moving the operations. We're doing it this fall for Eli Terry, moving it. And then in the summer, we're removing them now, we're abating, and we're going to be demolishing that building. This facility, you could build down below, but is that ideal for your operations? We didn't assess that. My preliminary thoughts is probably not, because now you have the hill up on top, the field to be up on top. I think it's placed in a good location on your site. The other option is you have to find a new site. For the guidelines of the state to build new, they typically, for an elementary school, they recommend 10 acres plus one for every 100 students. So you're looking at roughly 14 to 15 acres of land that you would need to find ideally to properly program a facility. It'd have to be obviously in this general neighborhood area of the town, whether there's property available or owned by the town, I'm not sure. But you would have a lower reimbursement rate for that. And then the other part of that is now you have an existing, many districts, they've done that, and they have this older building that is still up. Can't mothball it. You still have to heat it. You still have to maintain it. You just can't close it down and leave it to rot. So there's operational costs associated with building a new one on another site, and then keeping this building, maybe you repurpose it. That's obviously a bigger discussion within the town if you were to achieve that. So anything I didn't answer in that question?
No, I think you pretty well covered, all the aspects of it. And I think what I was trying to get to was there was a direction to the pursuit of a renovation as new based on how things are done on a state level and the projects that you do as a whole. What would you say your percentages are on a renovate as new basis versus alteration projects? Because I don't think they're even in the same caliber of each other, but I'd like to get you to differentiate if you could on what you normally
Sure.
see.
Yeah, when it comes to renovation versus alteration, with obviously ineligible costs being much less than a renovation, there's really, we work with the town of Fairfield exclusively on all their projects. And they do alteration, extension alterations. They don't apply for renovation status. And that's kind of twofold because they've maintained the condition of their buildings are pretty good already. And they've done a lot of work up front, but also their reimbursement rate's about 25%. So when you take the ineligible costs out, it's really not that much when they're doing an alteration. The extension's 100% eligible because they justify it with their ed spec and their enrollment. And then they do modest upgrades for what they need. They don't look at their program going, we need a whole brand new building in a Taj Mahal. They're very smart, and their cost per square foot is about $225, $250 per square foot for it. Other than that, most other districts that I've seen go for renovation status. Stonington did it. South Windsor's building all new. New Fairfield, they were told we're doing their high school there. They were told they have to build new because their existing building was so bad that Costa Diamante said, I'm not going to support a renovation. That's how bad it was. So a majority of them of alteration renovation are renovation status, with very few being alterations.
Okay, appreciate it. Thank you. Thank you, Madam Mayor.
Thank you. Counselor Donahue.
Yeah, I thank you. I mean, the presentation was excellent. My question is there, or we're going to ask the town to spend $35 million and we're expecting to get money back from the state. Is there a stopping point where, do we know if we're going to get money back for the state before we actually say we're going to spend $35 million, we're expecting to get back 16 to 19, change of government, whatever happens, the pandemic continues on, the money's not there.
Yeah.
Is there a stop point where we say we're not getting the money, and we're only expected, where I'm headed, right?
Yeah, absolutely. No, great question. So I brought back the project schedule to use it as the tool here. So as I alluded to before, if we submit the grant application in this June, which we hopefully will, we're on track for that. Your referendum's in November, and we will know by this summer of July 2021, roughly. It might be in May, depends on the session. They kind of vary, but roughly late spring, early July. They've always passed the legislation, with the exception of 2017. It got extended, and those commitments didn't occur until October of that year. But that was an outlier. It's mostly been, most of the letters you see, the grant commitment letter is in that June, July timeframe, depending on when they pass the bill. That is the point where you know if the state's going to participate or not. So with that said, some districts say, well, if we pass it in November, let's wait until we get the commitment before we spend any dollars. Okay. And they want to avert risk and spending the money. So during that time frame, the money you're spending is primarily on the architect. If OPM is selected, and then some CM costs you're almost in the middle of what they call, you're about 50% through the design, as you can see by the graphic. So total cost, you're probably, and I'd have to look at if I looked at the cash flow, I could actually tell you, if you don't mind me pulling that up. I could tell you what we would spend up to that, what we estimate to spend at that time. I can bring it up very quickly. bear with me here. So if you can see this cash flow analysis here, I'll zoom in a little bit. We provided this to your director of finance here, and I'll read it out. So this tells us if we start in January, starting the design in January or March of 2021, that's when bills would kind of start coming in from the architect, if you will, because until you select them, they're not doing anything. They're not billing you. There might be a few expenses, but very minor. But if we were to look through July, let me just look at my calendar again. We're talking July 2021. So through July 2021, we're estimating approximately $840,000 that you would expend through that time. And we would know in January of 2021 if you're on the priority list. Typically because you have to create the list by December 15 legislatively. If you're on that list, 99% you're going to be given a grant commitment unless something catastrophic happens. But anytime the list has gone out on December 15th, anybody on that list has received a grant commitment that nobody's ever been taken off that we're aware of. Well, through that July, you're looking about $840,000. Now, someone would say, well, let's wait until we get it, because if something happens, again, in January, December, you're going to know if you're on the list. So the odds are very, very good you're going to get a commitment. However, the other part is the time factor. Escalation. If you were to wait, you're going to lose. And it depends if you believe on escalation. We calculate escalation to the midpoint of construction because time is money. There's a good portion of that you might lose on a $35 million job at 3.5%, say for a year. You're about $1 million per year. Real round figures. You're kind of saving that in the tail end. So to wait, it wouldn't do you any good. So I would definitely recommend moving forward in your exposures, roughly $800,000 to $900,000.
Excellent chart here. Is that in our packet somewhere?
It's not in the packet. We just sent this. I'm just sharing so I can show you our calculation, the number. We sent this to your director of finance so that she can start working on tax impact to, obviously the taxpayers taking in your total, debt service and evaluating that.
I just wanted to make sure we weren't going to be into the project 30% and find out we weren't going to get the money.
No, we should know if referendum passes in November. We'll know by December 15th if you're on the priority list, which I think your odds are very good. Again, I don't control that. But at that point, you're just doing architect selection. So you're going to have a very high level of confidence if you're going to get a grant commitment before you even pay hardly any bills at that point.
Excellent. Thank you.
Welcome. Hopefully that answered that.
Great, thank you. Any other council comment or discussion? I don't see any other hands raised. I just have one question in terms of our next steps. So I know on the slide you had said that you need authorization of the total budget by the Board of Ed and the council. So I'm assuming that this will stay on our agenda moving forward. Is that true, Mr. Chapman?
Yes, that's true.
Okay, so we as a council will continue to discuss this item. Thank you very much. That was a very detailed presentation. And certainly if we have questions, we'll be in touch.
Thank you. Appreciate the time and welcome us here.
Thank you.
Thank you.
Okay, don't go anywhere, Dr. Brumman, because I think you're on for the next one too.
Yes, and I believe I have Lou with me, so.
I'm here.
Wonderful. So the next item is a bid waiver request for LED lighting project. I'll just turn it over to you to go ahead and present that.
Thank you very much. This was discussed with the Board of Education last evening, and I've asked Lou Jakimowicz to explain why we're requesting a bid waiver.
Hi, good evening, everyone. The bid waiver request spawned out of a competitive bid that we put out earlier this spring for HVAC controls at 3 of the schools in town. At that point, it was an energy integration company called PowerPoint Energy from Glastonbury that came around and was aware of the bid that was out on the street and was encouraging me to really explore the possibilities of the modifications that Eversource and CNG has made to their rebate programs, because by packaging lighting improvements along with the HVAC controls that we were looking to do, we basically had the ability to more than double the available rebate dollars. Now, I can't speak to the details of the formula that they were referencing, but all of the proposals and forecasts that I've received from them over the last 7-8 weeks have held up on that, where we're somewhere between 65 and 75% effective rebate rate compared upon the additional dollars that will be spent. To try to vet this, the company that is the apparent low bidder, who will be awarded the project very shortly for the HVAC side, also does the lighting retrofit work. And I had asked them to basically view the same 3 schools looking for the same issues and just make me a proposal as well from their perspective what it would be. So I could really vet the validity of the original company's assessment and whether the prices were exorbitant, or things were out of line. This wasn't in a competitive bidding situation where I was able to have the time to develop a set of bid specs that it was, specifically apples to apples, but it's 90% apples to apples between the work that one company did in their assessment compared to the others. And the rebate dollars, look pretty good as far as those numbers holding up. So I really view this as just opportunity management in protecting both board and town resources and trying to provide significant long-term improvements for the benefit of everybody. And from the taxpayer standpoint, the benefit we would get in reduced energy consumption has been estimated to be in the low 80,000 level long-term per year. And this is better or less than a 2-year ROI. It could be anywhere from like 1.1 years, to like 1.8 years, depending on how the final numbers fall on this. So just because of the compelling potential value to this, I don't have the time available to put this together before June 30th because the grant application has to be into the Eversource system before June 30th in order to qualify for this combination that's here. But we certainly will not have any interest in moving forward with the project. These rebates just disintegrate and are not something that we can really parlay into a much bigger beneficial win for the town and for the Board of Ed. So, what we're looking at is for additional $437,000 of lighting expenses for over 2,500 fixtures. That's an effective, and the net cost would be, somewhere around 116,000. We're well down to the $50 to $60 range per fixture for getting that installed. So it's very appealing option to try to pursue if the town is interested in having us go that direction. Last night, the board sanctioned this concept as well and passed it along to the board for consideration, to the town council for consideration. So that's kind of the short story, all about opportunity, and more than happy to answer any questions anybody has.
Okay. Counselor Donahue.
Yeah, I remotely attended the Board of Ed meeting last night, and I was trying to follow the discussion on, why this isn't a capital expense.
Mm-hmm.
And I couldn't quite make the connection as to why, this is something that's going to last over 7 years, we hope, right? So why isn't it in the capital improvement plan?
The per piece value of the lighting is well below the threshold. I believe it's a minimum capitalization amount that we even consider is $500. There was a similar discussion regarding the Chromebooks and removing it from the capital area because it did not have the individual unit value to justify being considered a capital item. The value for the lighting is even, substantially less than a Chromebook. And, this project encompasses over 2,500 fixtures that are going to be replaced or retrofit. So at that level, it would be consistently interpreted as we have done for the Chromebooks.
Yeah, but you're not, we're not going to submit 25,000 POs, right?
No, that's correct. It'll be one purchase order for the organization.
Okay, so it's still a total amount of, 473,000, right? It's still
Gross, right? Yeah, our obligation will be in the 116 range, somewhere around there.
All right. Thank you.
Okay, you're welcome.
Thank you, Counselor Donahue. Any other questions? So this would be then, we would be looking to take action on this at our next meeting, and timeline that would work for you, Lou?
Yes, obviously, as long as I have a few days to submit everything to Eversource before June 30th, we'll be all set.
Okay. Any other council questions? All right, this looks like a reasonable request in terms of the amount of savings that we would anticipate that you're pointing out. So, we'll look to forward this onto our next agenda, and we can discuss further and take action at our next meeting.
Okay, thank you for the consideration.
Thanks, Lou. Thank you. Thank you, Maureen.
Okay.
Okay, so we will move on to the next item, which is the annual suspense list, which I believe Ms. Murphy's with us. So I'm going to go ahead and turn it over to Janet for this one.
The suspense is killing me.
Hi, what you have in your packet is the suspense list from the tax collector. It's done annually. It removes off of the tax rolls and puts a suspense the latest year that she has on there. As I said, it's just the annual thing that she does to clean off. This one is from the grand list of 2004.
Okay. Any council questions? Okay. So this is, as you mentioned, an annual event, an annual need that we have to take action on. So we will go ahead and put this on our next agenda for further consideration and action. Thank you, Janet.
Thanks.
Okay, we'll move on to the next item, which is discussion of the 2030 Plan of Conservation and Development, the POCD. So we had delivered to our homes draft booklet of the POCD. The TPC Commission has been in the process of updating the plan that was adopted back in June 9th of 2010. The draft plan has been supplied for us to review as required by Connecticut General Statute 8-23. There will be no action. We're not looking to take action on this tonight, but more for discussion. If we have any questions or concerns, we can bring them forward and certainly get answers. The additional item is that the TPC Commission will be holding their public hearing on July 12th at 7 p.m.
Change that, Mayor.
I'm
Actually,
sorry.
it's the 22nd. That was a mistype on my part.
Oh, okay. July 2nd, you said?
July 22nd.
22nd. Thank you. So the public hearing will be July 22nd at 7 p.m. It'll be, at this point, it's scheduled to be via Zoom software. So we have time to deliberate and bring some questions forward. Councilor Menke.
Yeah, I've just started reading through this booklet. It's pretty concise and detailed, and I appreciate the effort that went into developing it and putting it together. I would like to read it a little further to go through from the front to the back, but it does look like pretty comprehensive, and I would like to see what the public has to say about it on the 22nd of July.
Yeah, absolutely.
Mayor, I will note that the chairman of the TPZ as well as the town planner is on the attendees side.
Oh. So I'm going to click over to the attendees. That's Mr. Payne, I believe, and Mr. Minor are over there. If either of you would like to address the council regarding this agenda item, you can go ahead and raise your hand and we can move you on over, or unmute you if there's anything you'd like to add to the discussion. I know, this is certainly an extremely important document as we move forward. We've all talked about the 2020 plan forever, and we've, used that to guide our decisions along the way for the last 10 years. So this is just moving us forward now into the next 10. So certainly a very important document for us to consider. And I know we have not had it in our hands for very long, so we can continue this item on to our next agenda as well if there's no other question or comment at this point.
No, doesn't appear so at the moment.
Okay, perfect. So I would ask that this agenda item be continued on to the next council meeting so that councilors can have some more time to review the document and bring forward any questions, concerns, or discussion items. Okay, we will move on now to the next item on our agenda, which is resignations and appointments. I believe we have an appointment to the Newington Housing Needs Study Committee. Councilor Annis, is that you?
Yes, it is. I'm sorry.
That's okay.
Resolved that the Newington Town Council hereby appoints the following member to the Newington Housing Needs Study Committee. TPZ Rep Stephen Woods, 94 New Britain Avenue, Party D, term TPZ.
Okay, you got muted somehow right in the middle of that, but that's okay. We heard. All right, is there a second to the motion?
Second.
Second.
Seconded by Councilor Braverman. Any discussion on the appointment? Seeing none, all those in favor say aye.
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 Any opposed? All right, motion passes. We will move on to the next item, which is tax refunds. We're looking for approval of the June 9, 2020 refunds for an overpayment of taxes. Deputy Mayor Bedrejko?
Resolved that property tax refunds in the amount of $283.85 are hereby approved in their individual amounts and for those named on the requests for refund of an overpayment of taxes certified by the revenue collector, a list of which is attached to this resolution.
Is there a second?
Second. Second.
Seconded by Councilor Nagel. Any discussion on this? Seeing none, all those in favor say aye.
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 Any
Aye.
opposed? Any opposed? Okay, motion passes unanimously. Moving on next to minutes of previous meetings. We have the May 5th, 2020 public hearing meeting minutes. Excuse me, May 5th, 2020 special meeting minutes, May 12th regular meeting minutes, May 18th special meeting minutes, and May 19th special meeting minutes. I'll entertain a motion to accept those.
So moved.
Second.
Moved by Councilor Menke, seconded by Councilor Camillo. I think we just lost Councilor Minor on our feed. Like literally
we
just
did.
popped out. Okay. So we have 8 present right now. So motion was made and seconded. Any discussion on the minutes? Seeing none, all those in favor say aye.
Aye.
Aye. Any opposed? All right, motion passes 8-0. Councilor Minor absent. The next item on our agenda is written oral communications from the town manager. Mr. Chapman, anything for us?
Nothing tonight, no.
Okay, thank you.
I have a question for the town manager.
Oh, go ahead, Gail. I'm sorry.
Sorry. I'll raise my hand first. Okay. Yeah, Keith, you were going to get us an update. I thought, considering we're talking about building committees, whatever, the status of the facilities consultant, wasn't there a report that was due last week?
We have not received a report yet.
Is there, are you gonna let it fire under them?
Well, I'm giving them a little more time, but the latest communication we got was that the individual had to be out of town, but apologized and would get the report to us on Monday. I have yet to see it, so I think it's time for a meeting.
Because, we really do want to get that information out there if there are any grants available, whatever. But was there anything in the contract that gave them I can't remember, that gave them a date for when they needed to have it completed by, or any interim reports?
I believe there's a deadline for the late fall, and they are supposed to be giving us progress reports, but I've not seen anything, and I don't believe they've started on any buildings anywhere.
Perhaps we should ask them to come to a council meeting and give us a report.
I would suggest that we consider doing that, yes.
Okay.
So we'll
Counselor,
add
makes
them to
sense.
the agenda. for
Perfect,
discussion.
thank you.
Okay.
Counselor Nagel?
Yes, I'd like to ask Mr. Chapman about, because of the COVID, there have been problems and confusion, and residents have been complaining to me about knowing what is open in the parks, what isn't specific, and also times when the library will be doing different things. I attended a library meeting, and I know that their times are shifting and whatever. How can the public readily know what times it's doing what, and where it can look? Because evidently people are confused, and I know these times make things shift all over the place. And in terms of the tennis courts in particular, there seems to be some confusion and arguments among some residents in terms of the use, especially of the Churchill Park tennis courts. And I just want to know if you can provide to us and to the town other ways of making that clearer as to when the tennis courts are used and park things are used and how they are supposed to be used, and also in terms of getting readily, without much difficulty, things in terms of when the library hours are for doing what they are doing, which they're doing very well.
Yeah, what we'll do is I'll put that all together over the next day or two and have it out, we'll say by the end of Friday, to update. Now that we've had Charlie Brown come in and talk about what the town should be doing, I assume we're going to take his advice and follow it. And now that that's been established, if it is, then we'll be able to give you specifics now.
I know people have been, some residents have been telling other residents when they get to the tennis courts that they're open and saying, oh, well, you can't be here. You need to go to Mill Pond Park. So it's getting to be an issue aside from just what's open when the town needs to know. I don't think any resident has the right to tell another resident that they can't use the facilities if they've gone through the proper procedures.
I would agree with that. Yes. Okay. We will provide a full update of all the activities in all of the departments.
Okay. And could you make certain you send a copy to me as well as other counselors so that we have that in case of other residents have those complaints, so it can efficiently be, information can be given, or they know who exactly they need to contact to know what things are what.
Sure.
Thank you.
It would be a good idea to attach that onto the website under the, I know at the top we have I'm looking at it now, the town hall facilities close to the public, but there's a read on tab where we can provide more information. That might be a good.
Yeah, we'll update all that.
Website.
Yes, we'll update it all.
Thank you.
Thank you. All right. I don't have any other hands raised, so we'll move on to council liaison committee reports. Deputy Mayor Bedrejko.
Yeah, just a quick, which I just thought it's interesting, and just for the public, at the TPZ meeting, there's been an application for a gas and convenience store at the corner of Hartford Road and Main Street. You know, kind of on the corner, that empty corner where there used to be I guess a gas station years ago. It's across from Yanni's and the donut place and whatever on that corner. So yeah, so they received, I think, a pretty favorable response from TPZ. There's still a couple things that need to be worked out. Particularly, there's been some concerns about the plans are that there's going to be entrance and exits on both Hartford Avenue and Main Street. And there's a little bit of concern about traffic backup at busy times, but beyond that, seem to get favorable response from TPZ.
That's great. Counselor Nagel?
I recently attended virtually the library board meeting and also at a separate time, the Senior and Disabled Commission. And some information that the public should know as well as the council. If those didn't know, there still is going to be a race, but it's been postponed to October. Hopefully they will be able to have their annual race then. The library's annual meeting is September 14th. What form that takes is, I guess, to be continued or yet to be decided. As mentioned earlier in this meeting, they're doing curbside services. They're also doing virtual programs during the course of the summer, and contact the library concerning that. And the question about cleaning and so on, we addressed earlier on. The Senior and Disabled Center is doing virtual programs as well, doing weekly phone calls to seniors to let them know what is available. They are doing food pantry deliveries to about 50 to 65 people to drop off. Volunteers are doing this. Dial-a-ride is only for critical situations at this particular time. The front of the senior center, since it cannot be used by the public at this time, the town is taking the opportunity to redo the front parking lot and do some lighting changes and sidewalks that are long overdue. Also, because the seniors have been unable to use the facilities for quite a few months, the board has decided to waive the renewal of membership fees. So anyone who is a member of the Senior and Disabled Center will not have to pay another fee this year, and your fee for last year will go through next year as well. And that's it. Thank you.
Okay, thank you. Counselor Donahue?
Yeah, from a NCTV perspective, we're working with Keith and Paul for the move over to the building. We have been getting a lot of programming from both the senior center and the library, and has been very well received by the public. They're doing story times for the kids that they're recording, and Diane over at the senior center is doing some programming that we're just broadcasting on 14. But we're looking forward to the move to our new home, and that's it.
Great. Any other council comment? Okay, we'll move on to public participation. Any member of the public would like to speak? I see someone's, we've got a few hands raised. Okay, so I'm going to go, the first hand is Susan Mazzacoli. If you could state your name and address for the record, go ahead.
Hi, Sue Mazzacoli, 149 Harris Drive, Newington, Connecticut. I wanted to be first to congratulate our new town manager. Maybe I should call you a rerun town manager. So welcome and thank you.
Wonderful.
That's it.
Thank you, Ms. Mazzacoli. All right, we have another hand up. The caller ID says Riley. You go ahead and state your name and address for the record.
Yeah. Hi, my name is Riley Field. I live at 119 Mountain View Drive. I'd just like to speak for a quick moment on this past meeting, and more specifically something that's got me a little bit frustrated and a little bit disheartened, honestly, watching through this meeting and paying attention alongside. Quite frankly, I was at the protest earlier last week, and to be completely honest, I'm a little bit disheartened at the fact that none of what was spoken about there or spoken about by your two constituents earlier this same meeting regarding racial bias within the Newington Police Department and even racial tensions within this town. I'm disheartened that none of that was brought up. I think, I understand more than anyone the stress of COVID and the importance and the worry that our community feels for it. Trust me, I understand. I go to work every day, 6 days a week, 9 hours each day, working in a big box store, the types of which we were discussing today. But I can't help but feel disappointed in the fact that no one even responded to, our constituents' comments earlier when they brought forth empirical and legal data highlighting these issues in our town. Being there in the streets, being there in the middle of Maine and Cedar, and hearing the stories from Black and brown people who had experienced firsthand the effects of racial bias, both in the school system, in public policy, with the police. It was horrifying. And I think, unfortunately, like, that is a reality that we have to deal with in this town. And looking at, the makeup of this town council, I understand that, you all, and even myself, we aren't privy to that sort of knowledge of racism and race as a concept, because we're white. But I think it's clear to me, at least, that there is pain in this town, there is pain in this community, that this issue is something that's clearly people feel strongly about, that isn't resolved yet. And I would implore you, I would beg you, please, if it's not on the schedule for your next meeting, to please take a look again at what Anna and what Charlie said earlier. Take a look at what your constituents said during that protest. Take a look at what people are talking about online. Pay attention, please, if you can, to all members of your community, not just the ones asking to open the town up. Pay attention to the ones who are talking about the police force and their experiences with them. Pay attention to the ones who are talking about their experience with the school system. Pay attention to everyone, please. This community needs healing, and I think some of us want to see from the top down leadership on this. I yield the rest of my time. Thank you all for coming here. Good night.
Thank you. Any other public participation? Okay. Seeing,
One more.
oh, I'm sorry. I'm trying to think for our rules of procedure. I think limit public participation to one at each. Ms. Mazzacoli, I apologize, but our rules of procedure only allow public participation once at the beginning of the meeting and once at the end. So I apologize, but I'm not going to be able to recognize you at this point. Okay, seeing no other public participation, I'm going to move on to remarks by counselors. Counselor Camillo.
Earlier, Charles Sullivan and Anna Saunders, I didn't get their address where they lived before they spoke. You have them?
It'll be part of the record.
Okay.
Yeah, and they'll be on the record, but I did write them down.
Yeah, I couldn't hear it. I'd like to
I'll
talk
send them
more.
to you.
Thank you.
Yeah.
Any other council comment? I'll just say, we did have a few members of the public today speak about the protest that happened in town the other evening. And I did not respond readily. I was not able to be at the protest. My mother passed away last week and I was handling some family business last week. And so, yes, those events have been brought to all of our attention. Several members of the council were there and were present. I won't speak to them. We are all concerned about what's going on in our town. We are certainly listening to those people that have spoken and doing the research that we need to do behind the scenes. So while we may not be speaking right now, giving an opinion of something or speaking outwardly in direct relation to members of the public's comments, I would just assure people that we are taking matters seriously, that we are looking into all things that are brought to our attention at this point and working to see where we need to go from here. So just please rest assured that this isn't being taken lightly. That being said, our next item on our agenda is adjournment. I would entertain a motion to adjourn.
So moved.
Thank you. Motion to adjourn made by Counselor Anist. Any, second?
Second.
Seconded by Counselor Menke. Any discussion? Seeing none, all those in favor say aye.
Aye.
Any opposed? We stand adjourned at 10:08. Thank you, everyone, for a very long evening. Stay well, stay safe, and we will see you next time.
All right, bye.
Thank you.
Bye-bye.
Bye.
So.